name is Charles Romasole. I'm the Director of Sales and Business Development for PURE. Thank you so much for this honorable opportunity that we all have here. I want to welcome you. I can see people all the way from South Africa, Nigeria, Ghana, the United States. This is really going to be amazing. Now, to kick off this medical symposium at this point, I want to consult one that's actually very key to the construction, to the organizing this medical symposium. Ladies and gentlemen, he's no other person but the Vice President for Europe, Middle East, and Africa. And he's Professor Ben Peter. So please, let's give it up for Professor Ben Peter.
All right, Charles, thank you so much. Good afternoon, good morning, good night, wherever you're calling from or joining us from. My name is Benjamin Peter. I am really excited to welcome all of you to this wonderful event. One of the things that's really special about this event is the fact that we have over 510 medical doctors who have indicated that they will be taking part of this event. So we're very grateful and very excited about that, because you medical doctors are in the front line of providing health and medical revolutions in your communities, in your countries, be it in Nigeria, be it in Ghana, be it in Cameroon, be it in South Africa, be it here in the United States. The doctors are in the front line of health all across the world. So we want to say a special thanks to all of you, our doctors. We're very excited that you're here. We're very hopeful that you're going to learn, that you're going to see the power of science that our company has introduced to the world, and hopefully when you see that, we'll be able to help you make some decision as to what our company is and what our company represents. So I'm really honored to welcome all of our doctors on the call, and for all of our team members and all of our distributors all across the world, I want to say welcome as well. We're very grateful, we're very thankful. Please stay tuned, enjoy this event, and let's connect at the end of this event. So thank you very much, Charles. Great job, Charles.
Yeah, thank you, Professor Ben Peter. That was really awesome. Thank you so much for that. We also want to thank everyone that's actually hooking up with us also on Facebook Live. We're actually live on Facebook, so that's really amazing. Thank you very much. At this point, we want to give a quick exposition of this symposium. I know we've been invited, you've had medical symposium, but we want to give a brief exposition on this symposium that's actually this medical symposium that's been held right away. And to do justice to that, ladies and gentlemen, I make welcome no other person but Reverend Darlene McGregor.
Hi, Charles. Hello, everyone. As Charles said, my name is Reverend Darlene McGregor, and when we first came to PURE in October of 2018, we were talking about bringing a next-generation medical breakthrough technology to Africa. With that in mind, I developed a vision for the medical community, because we really wanted to come through the medical gatekeepers of countries. And so we reached out to the NMA, we reached out to PSN, these top medical organizations, as well as the Ghana Medical Association and the Ghana Pharmaceutical Association as well too. So we brought them to the US, we brought them to a medical symposium for 2 days, where they could learn all about the science behind this technology that we were planning on bringing. It was still in development stages at that point. So we didn't even have a real product to be able to show them. It was still in development. And so we were able to get that product. We were able to have it NAFDAC approved. I believe that was September, October. And then come the new year, we actually signed MOUs with both the NMA and the PSN, and the Ghana Pharmaceutical Association has some heavy involvement as well too. And so we are really honored to partnering with these medical gatekeepers. We really wanted to come the right way. And I believe our product technology is the product to be able to bring to a medical community. And so our focus is on mitigating treatment failure using Purxcel as oxidative medicine. And so Dr. Lawrence Olajanu is also one of the brains behind all of this. He is an amazing PhD in immunology. I could never, ever have done this without Dr. Lawrence. I am the marketer. I am not a doctor. I can sometimes fool people for about 30 minutes because I just say the things I've learned from him. But he is a PhD and he is able to answer questions, show the science. And so he has been really foundational from the very beginning of this as well too. And so we just want to say welcome to everyone. Enjoy the presentation. We've got a great doctor lineup on this call today to be able to teach you on the science behind our product technologies. What's important to understand is this is next generation. This is nothing like anything anybody has ever done before. And so keep that in mind. It's new science, new developments, new technologies that are coming out at this time. So thank you, Charles.
Oh, thank you so much, Darlene. That was really wonderful. Amazing, amazing. Thank you so much. That's been Darlene McGregor. We thank you for what you do. Now, ladies and gentlemen, we'll be going straight into the first paper for today. This is a medical symposium. We thank you for every doctor, every medical practitioner that's actually on this medical symposium right now. So to take us on the first paper, we're going to be looking at an overview of the master oxidants, glutathione and SOD. And to do justice to that, ladies and gentlemen, I make welcome a top surgeon from the Department of Surgery, University of Benin Teaching Hospital, Benin City. I present to you Dr. John Ukwuoma.
Yeah, thank you very much. This evening, I will take an overview of the master antioxidants, glutathione and superoxide dismutase. And I'll be doing justice to this using this basic outline, using the above outline. Well, as a way to start an introduction, glutathione, like you see, is a major antioxidant compound. That's the nomenclature, that's the chemical formula. Of note is the sulfhydride group or the thiol group, the SH group, which is very, very significant in the activity of this compound. Now, let's delve into it proper. Glutathione is the master antioxidant compound. It functions as a detoxifying agent, and essentially it is produced in the cytoplasm of every living cell in the human body. Suffice it to say at this point that it is produced exclusively in the cytosol and is actively pumped into the mitochondria, where, of course, we all know is the energy point where most of the cellular activities, the powerhouse of the cell, lies. Glutathione is found in virtually all tissues of the body, but most abundantly in the liver, where it constitutes about 25%. It is a tripeptide molecule that's essentially composed of amino acid glutamate, cysteine, and glycine in various proportions. It exists in two different forms within the body, including the reduced form and the oxidized form. There are other sub-parts of it, which include the disulfide cysteine containing form, and of course the protein-bound form. All of these exist in a flux, transforming between forms as they split into components, which are synthesized over and over. This is to say, glutathione in the body is synthesized over and over. Now, the safety here is to gain the fact that in many clinical trials, it has been observed that oral glutathione has no particular adverse effects, and it can even reverse the toxic effect following excessive intake of other amino acids in its category. Now, the reduced form of glutathione, GSH, is essentially the biologically active form that has earned glutathione its reputation as the body's most important antioxidant. Now, what are the essential determinants of cell redox status and oxidative stress in the body? It has to do with the ratio of the reduced form, GSH, and the oxidized form, GSSG. Now, this hovers on the fact that it has also been shown that in the body...
Hey, Dr. John,
yeah.
Can you put a full screen? Can you put your slide on a full screen? That way...
yeah, I'll do that right away. Thank you.
And then also your view is a little bit blurred out. So your background, you might want to remove it. That way we see your really good looking face.
is that it has been shown that in healthy cells at rest, the reduced form of glutathione, which is the most active, the bioactive form, is in a ratio with that of the oxidized form in more than 100 times, while this proportion tends to drop when the tissue is exposed to oxidative stress. Now, why glutathione? The human body, like we all know, contains trillions of cells, and daily we create over 40 billion new cells. Every of these single cells requires the function of glutathione to survive. Now, this is the essence and the meat of this discussion, because this substance has shown itself to be the most important and the most powerful antioxidant of the body. Now, look at this. What is the problem here? The big problem, as we see, is that as one ages, the oxidative stress in the body tends to increase, while the master antioxidant tends to reduce, as this is depicted in the graph here. Now, the critical role, what are these critical roles of bioavailable oral glutathione? One, it functions as an antioxidant. Now, glutathione is said to be protective. Now, it being an effective electron donor, it does this by reduction and neutralization of lipid peroxidases, hydrogen peroxide, and other reactive oxygen species, and free radicals produced essentially in the liver by the phase 1 liver metabolism of chemical toxins. If you look closely at the diagram, at the pictorial representation here, you will note that the process of neutralization of this free radical is catalyzed by glutathione peroxidase, transform the reduced glutathione into its oxidized glutathione. Now, critical to this is the fact that when the oxidized form is recycled back, the reduced form, with the help of enzyme glutathione reductase and electron donated from the reduced form of nicotinamide adenine dinucleotide phosphate, tends to revert back and produce more of the reduced form of glutathione, which is the bioavailable part that is very active. Now, it also functions in anti-aging. This is very crucial. Most of our patients require this because it tends to reverse the effect of aging on every individual, and hence makes the body smooth, freshens the body, as well as makes the skin radiant. It enhances wound healing. It has been shown to be a cofactor for several antioxidant enzymes. It also plays regulatory function, where it participates in thiol protection and redox regulation of cellular thiol proteins under oxidative stress by protein S, glutathione, a redox regulation, post-translational thiol modification. This is very, very key because thiol protection is very important. Protection and regulation of thiol containing proteins during oxidative stress is achieved by the formation of these mixed disulfides with the reduced form of glutathione. Now, what is this metabolism we are talking about? For the metabolism to occur, it is required for the biosynthesis of leukotrienes and prostaglandins. And what are leukotrienes? Leukotrienes and prostaglandins play essential role in inflammatory reactions, allergic and asthmatic reactions. Of note is that prostaglandin is important in the function of smooth muscle contraction and relaxation. You can see that it also enhances the function of citrulline as part of the nitric oxide cycle. And nitric oxide, as we all know, is a vasodilator. It causes vasodilation and increases blood flow to areas where there is a paucity of blood supply. It's a cofactor and acts as glutathione peroxidase. Of note is the fact that glutathione inhibits tyrosinase activity and that of eumelanin synthesis. Eumelanin increases the ratio of pheomelanin, which brightens the skin, removes dark spots, prevents and or remove pimples, and of course, pimple marks, as we all know. Now, I brought out this pictorial representation to also get these things clearer and to bring it home. Its detoxification mechanism involves essentially the liver in over 25% of cases. Now, you can see that these toxic heavy metals, alcohol, and what have you, are essentially guided by glutathione in the liver, where they are broken down and eventually metabolized and excreted from the body. Some of these also are in harmony with the kidney, which also elaborates glutathione, which functions essentially also with the liver to remove excessive toxins from the body. It is deployed for the detoxification of toxic metabolites produced under oxidative stress, transportation of mercury out of cells and the brain, regulation of cellular proliferation and apoptosis. It is vital to mitochondrial function and maintenance of mitochondrial DNA. Glutathione also plays function in conjugation. Here, it facilitates metabolism of xenobiotics. I want to say that xenobiotics are chemicals which are found within the body, but are not produced in the body of the organism. Now, it facilitates this metabolism by using glutathione S-transferase enzyme, which catalyzes the conjugation of lipophilic xenobiotics, facilitating their excretion. Of course, if they require further metabolism, this is also carried out. As regards immune function, it stimulates natural killer cells. Natural killer cells by promoting healthy functions of the T cells as well as other white blood cell population. Of note here is the importance that impaired glutathione synthesis or dysfunctional glutathione metabolism, or of course, glutathione depletion may be implicated in etiology and progression of a wide range of chronic diseases. Now, for example, polymorphism in glutathione peroxidase appears to increase the risk of coronary heart disease and stroke in some patients. Now, it is important also to mention that levels of glutathione are substantially lower in the substantia nigra within the central nervous system of the patient, especially patients with Parkinson's disease. Also, diminishing levels of reduced glutathione have been shown to be associated with age-related cataracts, glaucoma, and of course, macular degeneration in the eye, as well as glutathione depletion. This is important because it may be implicated in the pathogenesis of some cancers within the body. It is also important. Some studies have also shown that certain neurotransmitter potentials have been elucidated for glutathione. This, or the other speakers may also dwell on and tell us a little about them. Now, what are these benefits of glutathione? I'm just going to run through them. It strengthens the immune system, improves mental focus, acuity, and clarity, reduces the harmful effect of stress, optimizes the body's energy level, detoxifies your body, organ, and cells of toxins. It also helps you to get better sleep and makes you look younger. Of course, makes the skin healthier with its eumelanin and pheomelanin that it produces. It enhances athletic ability and performance. And of very significant importance is the fact that it enhances sexual health as well as libido, increase in libido. Now, let's also look at what certain diseases that are associated with glutathione depletion. This includes neurodegenerative disorders. Neurodegenerative disorders like Alzheimer's disease, Parkinson's disease, Huntington's disease, amyotrophic lateral sclerosis, and Friedreich's ataxia are important neurodegenerative diseases that are present in absence of glutathione, especially the reduced form. Others include pulmonary diseases, chronic obstructive airway disease, asthma, acute respiratory distress syndrome, immune diseases like human immunodeficiency infection, autoimmune diseases, cardiovascular diseases like hypertension, myocardial infarction, cholesterol oxidation, chronic age-related diseases like cataract, macular degeneration, and of course, hearing impairment and glaucoma, like I previously mentioned. Now, let us look quickly at superoxide dismutase. I am drawing a general overview on this subject. Superoxide dismutase is an enzyme that alternately catalyzes the dismutation or partitioning of the superoxide radical into ordinary molecular oxygen and, of course, hydrogen peroxide. Superoxide, like we know, superoxide is bad. It is produced as a byproduct of oxygen metabolism, and if it is not regulated, it causes cellular death and damage by way of apoptosis. Now, I just use this to depict generally what I mean. Now, by essential mechanism of stress induction in most patients. Mechanism of oxidative stress. Here, there is impaired balance between the reactive oxygen species and production, their production, as well as production of antioxidant defense within the body. This essentially what it does is that it increases accumulation of oxidative substances. Now, there are various causes that are attributed here, like smoking, alcohol radiation, pollution, stress, aging. Of course, these things will cause elaboration of nicotinamide adenine dinucleotide phosphate oxidase, as well as xanthine oxidase. And this causes respiratory burst and respiratory change, leading to propagation and production of superoxide. Superoxide dismutase, like you see there, tries to block this pathway from getting to, tries to break down this superoxide into its other lower molecules like hydrogen peroxide. But the of note here is that the hydrogen peroxide, like we also know, it has a damaging effect, and it is degraded by the enzymes such as catalase C80 that is written there. Thus, the superoxide dismutase is an important antioxidant defense in nearly all living cells when exposed to reduced oxygen. Superoxide dismutase catalyzes the disproportionation of superoxides. In this way, the oxygen is converted into two less damaging species, and then they are coupled. This is what exactly is depicted in the diagrams here. Oxidative damage to the DNA, protein, lipids, and of course, this tends to lead to various ailments. Now, let us briefly look at the various types of superoxide dismutase. There are essentially three major families of superoxide dismutase. This depends on the cofactor, the protein cofactor, that metal that is attached to it. When copper or zinc is attached to it, this is said to be the SOD1, the type 1 SOD. When it is iron or manganese that is attached to it as the cofactor that binds to it, it is referred to as SOD2. The nickel type is the SOD3. Now, the important thing here is that there are essential functions which we need to know superoxide dismutase plays. It's a very important antioxidant defense against oxidative stress in the body. And within a cell, the superoxide dismutase constitutes the first line of defense against reactive oxygen species and free radicals. So essentially the benefits here, in fact, includes that it enhances joint health, enhances recovery of male fertility, relieves one of physical pain, improves recovery and well-being, reduces acne, help in ultraviolet protection, and of course, enhance cellular reduction. And of course, in eye health is also key, crucial in eye health. I want to quickly look at aloe-acemannan. Aloe-acemannan is a probiotic compound, or what others refer to as a prebiotic compound. Now, it is this property of probiotics. Well, of course, probiotic compounds that stimulate growth of essential beneficial bacteria within the body. Now, this property it has is mainly attributed to its mucilaginous leaf gel, which has pharmacological, cosmetic, as well as food industrial importance with great economic projections. This gel contains various polysaccharides, including an acetylated glucomannan known as acemannan, which has nutraceutical properties. And this particular is of importance because it's the most abundant of all the polysaccharides. Now, the active components in aloe includes atraquinones, chromones, and polysaccharides. And of course, other enzymes which are also present. The most important information here is that these hormones, these atraquinone and chromones, are responsible for the anti-cancer and anti-inflammatory properties that are derivable from aloe-acemannan. Of course, I brought up this to show us the other. But what are the benefits here? It modulates the immune system via immunoregulation, accelerates wound healing, and of course, healing of bones wound, especially when it is applied. It accelerates healing of ulcers and post-surgical incisions, and it has anti-neoplastic and antiviral effects. It can be used in the management or in prophylactic treatment of some cancers, especially wounds arising from cancer. And of course, it's an antioxidant. It promotes bone proliferation and improves neuroprotection. This is key because it also has promotes intestinal health. The the most significant part of this presentation is the fact that the use of glutathione as well as superoxide dismutase, coupled with alloasmannan, is key because this allows translocation and transmission via the cellular membrane, the lipophilic and the fatty and the lipid aspect of the membrane. It allows coupling to occur, especially with the alloasmannan. Now, by way of conclusion, free radicals are a necessary waste product of cellular energy production. But our cells must rid themselves of this waste or succumb to the ravaging effect of oxidative damage. Glutathione acts in every cellular compartment, the cytosol, the nucleus, and the mitochondria, to quell the effect of free radicals. Adequate glutathione is not just desirable, it is essential to the survival of each cell, making it essential to life itself. This is according to NDT Nakazov. Superoxide dismutase and alloasmannan supplementation with the master antioxidant has created a holy matrimony of masterpiece technology that defines the pinnacle of nutripharmaceuticals. Thank you very much.
Wow, that's pretty powerful. Thank you, Dr. John Okonkwo. That's really amazing. He has just been able to give us a very brief introduction of an overview of the master antioxidant, the glutathione SOD. Powerful. Thank you, Dr. John. At this point, we want to look at Purxcel. We've talked about Purxcel. We've looked at Purxcel from the glutathione and SOD level. And I believe when Mark Moses comes, we're also going to look at it, how it's able to help solve major issues as far as chronic ailments are concerned. But at this point right now, ladies and gentlemen, it's my honor to have the originator, the formulator of this particular product. Purxcel is a interactive technology. It's really very, very effective. So it's with great honor and pride I really get to call on Mr. George Renniger to give us the philosophy behind this product called Purxcel. So let's make welcome Mr. George Renniger.
Thank you very much. Can you hear me okay there?
Yes.
Are we good?
Yeah,
okay,
go ahead, George.
Okay, wonderful. Well, if you can follow me along on the screen here, hopefully my slides will move along. You know, the excitement about PURE in Africa and Purxcel, really originated with a business meeting between myself and at the time, the CEO of PURE. I was actually presenting a financial product because I have a history in nutrition and in global micro business development, but I was actually meeting on a completely different topic. But that morning, because of a providential encouragement from a very prayerful woman, when asked if I would be willing to be involved with PURE, it was in my spirit to do so. And ultimately, there were 4 things that had to happen for me to be involved with PURE. And that's what came out of my heart when they asked me was, number 1, the business would belong to my wife, Katie. So my wife, Katie, who you can see on the picture there in the screen with Benjamin and the former CEO of PURE, she's the IBO here. So I am not an IBO. I actually involved in other things. But number 2, when they asked me if I'd be involved, I said that there would need to be a decision to go to Africa immediately. And that was very new for the PURE company at the time. They told me they had no plans for Africa. They had no people to resource Africa that understood Africa. And they asked me, why Africa? And my response was, because of the low glutathione levels in the people. The average life expectancy in Nigeria is 53. In Ghana, it's 62. And actually, in Uganda, it's 62. In South Africa, it's 62. There's a low life expectancy. And what I feel in my spirit is, and maybe you can even say this, 53 is not enough. 62 is not enough. Especially when you look over in the West and places like Canada where people are living 81, there is a better, we can do better. And so the third point that was brought up was that there is a breakthrough in glutathione technology that has happened in the last few years, and that's really the bioavailable glutathione that we're talking about today. But they would be willing to let me work with research and development to develop and bring out a product that would take care of this oxidative stress. And that's what you're hearing about today. And the fourth thing, which we'll talk about before we close out today, was that they need to allow the business to run at half the PV, half the cost of what it takes to run it in the U.S., because we have to be able to get this product to the people. And, at the end of that little meeting, which was very providentially inspired, it wasn't in my list to do, there was an agreement to go forward, but it required one key thing. And that was that we would have to meet with Chairman Jung, and he would have to make a decision whether the company could move into it. And this is a picture, actually, Benjamin and I, we were presenting this scarf to Chairman Jung when he was saying yes to Africa. And so this is now, that was actually December of 2018. And since that time, we have moved forward. Now, what you see on your screen right now is just a collage of Google information. Average life expectancies in Africa, as you can see, Canada and the United States are upward of 80, where if you get to Cote d'Ivoire and Nigeria, you're looking at about 53. When you get to Ghana and South Africa, you're at 62. And the next graph over there, if you just Google the word centenarians and glutathione, you will see that the people that are living over 100 around the world, because that's what a centenarian is, they all have this biomarker of high glutathione levels like a young person. And so that tells me something, especially when we're going after this issue of potentially, improving people's longevity or quality of life. And so before I get into too much, I want to update. This is just something that gets sent out to us in America. You haven't seen this in Nigeria because your rules are a bit different, but we operate under some compliance rules. And so when I communicate, I try to stay in line with what's been asked of the company. And this is a document that actually came out just a couple of weeks ago, especially as Africa is becoming the fastest growing market for Pure. There's those that want to understand what we're doing. But I want you to know that I strive at all times, even when not in the United States, to live according to these compliance rules. And that is all based on something called the Dietary Supplement Health and Education Act of 1994. So this is a law that was passed in the United States. And I just want you to understand the relevance of this law to allowing us to do what we do, but within boundaries. And so I'm just going to read a couple of lines of this, but we have a number of medical doctors. I understand we have over 500 doctors registered today to go through this and to get educated on glutathione, but this is part of the process. So let me just read this so you understand why nutrition really does matter for human health. And the United States is trying to lead the way in this. Item number 1 of this law is findings that Congress has found that improving the health status of the United States citizens ranks at the top of national priorities of the federal government. The importance of nutrition and the benefits of dietary supplements to health promotion and disease prevention have been documented increasingly in scientific studies, which is what you're hearing some of today. And there is a link between the ingestion of certain nutrients or dietary supplements and the prevention of chronic diseases such as cancer, heart disease, osteoporosis. And clinical research has also shown that several chronic diseases can be prevented simply with a healthful diet, such as a diet that's low in saturated fats and cholesterol, sodium, with high proportion of plant-based foods. Healthful diets may mitigate the need for expensive medical procedures, such as coronary bypass surgery or angioplasty. Preventive health measures include education, good nutrition, appropriate use of safe nutritional supplements will limit the incidence of chronic diseases and reduce long-term healthcare expenditures. So now you're understanding why today we are running this health symposium, and we are doing it actually in harmony with this DSHEA law. That's what they call it, Dietary Supplement Health and Education Act, DSHEA. And number 6, the promotion of the promotion of good health and healthy lifestyles improves and extends lives while reducing healthcare expenditures. So there's your longevity of life being referred to. Reduction in healthcare expenditures lists paramount importance in the future of the country and economic well-being of the nation. There's a growing need for emphasis on the dissemination of information linking nutrition and long-term good health. You know, and I can keep reading through this. These are such powerful statements. I'll do one more maybe, and then we'll go on. Consumers should be empowered to make choices about preventative healthcare programs based on data from scientific studies of health benefits related to particular dietary supplements. And it goes on to talk about the economy in the United States and how dependent we are and the volume of business that has increased in dietary supplements in the United States. Now, before I go any further, I also want to point you to the physician's desk reference, which is an equivalent to the English BNF. This is an online version of that same document called PDR.net, N-E-T, PDR.net. And you can put in the word Purxcel, and it will bring up full prescribing information and the details of the product and what it can do for your health. So as we move into this philosophy behind the product, I want you to understand that this is what was in my spirit when I was sitting there that day, and it was just a vision. And it was a very surprised one because of what had happened in the morning with a woman giving me a prophetic word to be looking forward and to be open when I was asked this question. This is what has arisen out of that one inspirational word that I received in the morning. And you know what's so exciting? Here we are. We've had over 900 people on this symposium today. This was nothing more than a prophetic word one morning, and I think it was October of 2018. And here we are, and all the lives that are being impacted, and we are all a part of that. So Purxcel, you've heard about the triactive technology. I'll skim through some of these slides just because, John, you did such a great job of hitting the details of these. But it is the three operating as one that creates the power of Purxcel. It's the glutathione, and we also do precursor glutathione. We haven't talked about that much, but we use acetylized cysteine. There's over 5,000 studies on PubMed showing the power of NAC as a glutathione precursor for intracellular development and production. So anyways, you know, your body has trillions of cells. They all need glutathione to function. John, I think you pulled this slide up and hit these key issues regarding glutathione, but it's about oxidative stress. When we're exposed to things like the UV rays, especially strong in Africa, the toxins in our environment, you know, being in a pollution rich environment, I just have to say, you know, I've got a gray collar on, but when I go through Legos with a white collar, by the end of the day, it's more gray than white. And you all who live there or have been there know. And all of those toxins in our food, our water, our oxygen go into our bodies, and our body has to neutralize it and remove it. And when it doesn't, cells with oxidative stress look like what you see on the screen. And so this is the issue really in health. And this is the big problem, the big picture. As we age, our supply of master antioxidants decreases with age. And this actually does come out of a clinical study that was done here in the United States where things are a little healthier. And as we age, our toxic exposure and the load of toxins we're carrying can increase, especially when we're taking pharmaceutical drugs. You know, Paracelsus, the father of pharmacology, said all drugs are poison. The benefit is in the dose. And so when you take a drug, especially if you take it not the way it's prescribed, you end up with a heavy toxic load. And so what can happen is when there's not enough master antioxidants, glutathione, SOD, you know, even the aloe mannan, your body can move into a health crisis. And just think of the Titanic. More water coming in than the pumps can get out of it. That ship is going to go down eventually and start to break down. These are diseases that are associated with a low glutathione level. Now, we're not saying that our product treats these diseases. What we're saying is our body can support the glutathione supply to the body. Every one of these diseases are associated. So there's a relationship between those diseases and depleting a glutathione. So what are our three ingredients? It's the glutathione, bioavailable and precursor. It's the superoxide dismutase and the aloe mannan. John's covered SOD in quite good detail, and I'm going to hit just a little bit more on SOD in a few minutes, but arguably also the master antioxidant. Matter of fact, I like to think of SOD and glutathione are kind of like the male and the female of master antioxidants. And there's a big argument about this one's the most important, and there's another one that's this one's the most important. But every one of us know that it's when male and female are united as one that life emerges and the most powerful unity in the world happens. And that's what we decided to do in this product. Rather than to get into the argument, we just decided to take the most bioavailable, double-blind, placebo-controlled, human-studied sources of both glutathione and SOD and put them in a single capsule so that you would get a clinically effective amount. It was measured in the clinical studies in one single capsule every day, and that would be a change to human health. So this product was really architected around evidence and clinical science. And Ace Mannin, the third ingredient, the aloe plant, when you break an aloe plant, it's hard and crunchy, and there is a gel that's inside of it. But after a few hours of sitting there, there's an enzyme that will eat the mannose molecule, the long chain and small chain polymannose molecules there that are responsible for what it does internally to the immune system. And that's why fresh aloe works so powerfully. And often what people buy in a product called aloe vera does not work. It's because that active ingredient has been destroyed through their processing. And so the benefits of Ace Mannin are exceptional. And I'm going to move through. We do have other support ingredients, but what the proposal here is, what could happen if we, through a simple nutritional supplement that has validated scientific evidence behind the key ingredient sources that we are using, what if we could support your body ongoingly so that those master antioxidants stay at as high a supply as we can put in our body? What would happen to that health crisis? Is it possible, by letting your body have the ability to neutralize, detoxify, repair, and regenerate, which are all the things glutathione does, what if we could have that in ample supply? Could we change the outcome of human health? And so I'm going to jump forward, and based on what I shared with you about Deshay, I just want to point to a couple of PubMed studies before I step out of this function as the formulator of the product. This on the screen right here is the double-blind, placebo-controlled study that was done on the source of glutathione that we are using. And so you can see in the conclusion that these findings show for the first time that consumption of glutathione supplements was effective at increasing body compartment stores. Now, listen, I want you to go to the chat side, and I want you to write in the word "for the first time." So for the first time, or put in there first time, because what I'm saying is this. I just was sitting with somebody who was a pharmacist just yesterday talking about glutathione, and they were saying, well, you know, you can't take supplementation because it all gets broken down in the digestive tract. And I said, you know, that was true. But for the first time, through a manufacturing patent that takes and uses a fermentation manufacturing process, this glutathione is bonded in such a way that it is strong enough to get through the digestive tract, according to the studies, and still natural in such a way that it is not only absorbed into the bloodstream, but even in the cells. And our study, if you look at all the markers, it's over 325% when you look at all the markers together. Now, that is a powerful proof. And this here is just another PubMed study that talks about the value of glutathione. John said some of this, and in summary, I'm just going to read this little highlight. It just says, glutathione plays important roles in antioxidant defense, nutrient metabolism, regulation of cellular events, including gene expression, DNA and protein synthesis, cell proliferation and apoptosis, signal transduction, cytokine production. I mean, has anybody heard about cytokine storm right now? And immune response, and protein glutathionylation. Now, it's saying glutathione plays an important role in that. That is the operating system. I'm an old systems engineer. It is the operating system of the human cell, okay? And glutathione deficiency. Now, remember, we're not making a medical claim. We're showing a relationship, and that relationship needs studies. And that's why we came to the medical field first. We want those studies to be done. Glutathione deficiency contributes to oxidative stress, which plays a key role in aging. Now, is that not an answer for how I started this philosophical purpose of this product? And the pathogenesis of many diseases. Glutathione deficiency contributes to oxidative stress and the pathogenesis. And if you look through that list, you know, kwashiorkor, Alzheimer's, Parkinson's, liver disease, cystic fibrosis, sickle cell anemia, HIV, AIDS, cancer, heart attack, stroke, diabetes. I mean, everybody ought to just step back, take a deep breath, and go, "Oh my gosh, this is incredible."
Wow.
Well, let me tell you too. When I started in this glutathione research, and this was probably almost 10 years ago, there were 77,000 studies on PubMed. If you put in the word glutathione, you got 77,000 studies. If you do this right now, matter of fact, while you're sitting there, pull up your phone, go to PubMed.gov. Now, this is not pure marketing science. This has nothing to do with our company. This is pure scientific inspiration and passion going to work. And you go to you go to PubMed.gov and type in the word glutathione, and you see how many studies come up. There are over 151,000 studies. That's how much it has grown. And it's grown by almost like 8,000 in the last year, because this is where science is looking for the answer.
Wow. Thank you so much, George. That's really powerful. That's really powerful. This is really mighty. Glutathione playing an important role in antioxidant defense. That's really amazing. Thank you for everything you've actually mentioned. We are really very excited to hear this profound research. And ladies and gentlemen, like you said, you can go to PubMed.gov and then you're going to get more hints about some of these things that he actually displayed right now. Very importantly, immediately right now, we're going into some very important messages. Now, as PURE has grown over the past few months, because of the effectiveness and efficacy of the product, Purxcel, we've built some very beautiful relationships with the Nigerian Medical Association. We've built beautiful relationships with the Pharmaceutical Society of Nigeria. So at this point right now, we'll be taking up some goodwill messages from the Nigerian Medical Association and then the Pharmaceutical Society of Nigeria. But to take us further on the goodwill messages for the Nigerian Medical Association given by the NMA president himself, let me welcome Dr. Tonnie Okoye as he takes this goodwill messages for us. Thank you, Dr. Tonnie. Over to you, sir.
Yeah. Good evening, everybody.
Good evening, sir.
The Nigerian Medical Association wishes to commend the giant strides of PURE company in Nigeria in the last 1 year. The PURE efficient products with high safety profiles are supporting the clinical outcomes in the management of many chronic ailments and the general well-being of people. The NMA identifies with your cutting-edge nutritional technology in healthcare and well-being and would continue to partner with PURE in the years ahead. As we congratulate you in the determination to continue to host CME for members of NMA through medical symposium, we want to believe that diligent care must be taken to deliver such contributions to knowledge in keeping with our mutual understanding that you cluster the doctors within their various state branches, which shall be our basis to continuously monitor and improve the skills in deploying the products as a complementary therapy by Nigerian doctors, so that the confidence of the people in the products is safeguarded at all times for shared prosperity in well-being and health. Congratulations, Dr. Prince Francis Adedeye Fadile, President, Nigerian Medical Association.
Wow, that's really exciting. Thank you so much, Dr. Tonnie. We are so excited about this partnership, and we look forward to continue to grow with the strategic relationship we have with the NMA. So thank you so much, Dr. Tonnie. Charles, go ahead.
All right. Thank you, Dr. Tonnie. Again, like Dr. Ben said, we're really so excited. Thank you. Now, another very important organization we've built a very good relationship with also is the Pharmaceutical Society of Nigeria. And we're honorably very happy to actually have a goodwill messages from the PSN president, which is Iwuafor. And that message is actually going to be read by pharmacist Ejiro O is the Deputy President South for the Pharmaceutical Society of Nigeria. So, Pharmacist Ejiro, over to you.
Good evening, all. I wish to congratulate the People United Wishing Everyone Pure family on its medical symposium holding on this very day, 16th May 2020. There is no better time to have this event than now, when the world is facing a pandemic as never seen in recent history. Pure is known to provide safe, effective, top-of-the-line products to support personal health goals, and are devoted to empowering partners to become the best versions of themselves. I am certain this symposium will avail participants opportunity to interact, learn, network, and be exposed to new business opportunities. I therefore, on behalf of all pharmacists in Nigeria, send out our best wishes to the Pure team, wishing them a blissful symposium, and pray that the organization is enabled to perform better than it already is. Congratulations and God bless. Mazi Sam Ohambuwa, President, Pharmaceutical Society of Nigeria.
Oh, thank you so much, Pharmacist Ejiro. We really do appreciate you and your organization. The PSN is a very important organization in Nigeria, and we are very proud of our relationship with the organization, and we pledge to continue to do our best to strengthen this strategic partnership as we move forward. So thank you very much. Charles?
At this point, ladies and gentlemen, we've had the goodwill message from the NME president and the PSN president. We'll be moving straight into paper 2 immediately. This paper is actually going to be looking at pure from a pharmacological perspective. And to take us in that particular paper is no other person but Ejiro O Foyibo, like we just heard. She's a deputy president South for PSN. And so we are honored to have Pharmacist Ejiro. So Pharmacist Ejiro, over to you.
Okay, good evening all. Permit me to share my screen. Okay. I'm going to talk on the examining Pure SL from the pharmaceutical point of view. I will start by talking, the outline for my presentation this evening is just going to be very little because so much has been said and it's still going to be said. I'm going to look at the product PSL, the human cell and its function, antioxidants and oxidative stress, and then the role of Pure SL, and then we conclude. Pure SL as a product, triactive technology, beautiful, is made up of 18 complementary ingredients, and all the ingredients are plant-based and none is chemically synthesized. And the ingredients, some of them have been talked about by the previous speakers. As these are the products, the ingredients that are in the products. Then I will look at the cell and its function. The human body is made up of trillions of cells and we produce billions daily. The activity of an organism depends on the totality of these independent cells. In other words, if the individual cells are sick, the organism as a whole is sick. And you have the cell is made up of the cell membrane, the nucleus, and all that. The nucleus is contains the genetic material, and then the mitochondria is the powerhouse of the cell that produces ATP, which is the fuel for every cellular process. In other words, without ATP, every cell will just be dead. And the process involves the reduction of molecular oxygen to form the process involves the reduction of molecular oxygen and in this process, reactive oxygen species are produced as an end product, which we term as free radicals, and are very, very reactive and could be destructive to the cell. And some of them are superoxide anion, hydrogen peroxide, hydroxyl radical, and the singlet oxygen. These are generated as a part of normal aerobic life processes. So as far as a living cell is alive, this process will continue. Then let's look at this reactive oxygen species. They are needed for normal synthesis of cellular structures and activities in the cell. Then they are useful also in defense, in pathogenic defense by phagocytes. In fact, the phagocytes in the cells, they synthesize hydrogen peroxide. It is this hydrogen peroxide that they use in fighting invading pathogens. But when they are in high concentration, they can become very destructive in the cell, and this is the time it is referred to as oxidative stress. And so what is oxidative stress? Oxidative stress is caused by the imbalance between the production and accumulation of free radicals in the cell and the ability of the body to detoxify these radicals. God has created the human body in such a way that these things are useful. They come up as a byproduct of a process. Some of them, these byproducts are useful, but in excess, they become very destructive to the cell. So oxidative stress has been implicated in incidence and progression of several disease conditions, as we have heard previously, and I'm sure so many other people are still going to talk about them. And some of the destructive processes could be like even at the cell membrane, the lipids could be destroyed, the DNA can be broken, the proteins can be oxidized, and even enzymes can be inactivated. So there is a lot of damage that can go on within the cell if these reactive oxygen species are left to thrive in the cell. So in a good state, the antioxidants are capable of neutralizing these radicals. But God has created a defense system in the body, and this body is made up of we have what we call the antioxidants, which could be enzymic or non-enzymic. And what they do is to be able to mop up these free radicals and make them become less harmful to the body. And some of them are just what I've shown on the slide here now: superoxide dismutase, glutathione peroxidase, alpha-lipoic acid, ferritin, bilirubin, catalase, glutathione, and so on. And they are classified according to how and where they are. And you have the first-line defense antioxidants, where you have the superoxide dismutase, the catalase, and the glutathione peroxidase. And what this one do is they mop up these free radicals. The superoxide dismutase, for instance, we dismutate the superoxide anion to hydrogen peroxide, and then the catalase and the glutathione peroxidase will complete the process, breaking it into water and molecular oxygen. Then you have the second line of defense antioxidants, where you have the glutathione, ascorbic acid, vitamin E, vitamin C, and all that. These are scavengers. What they do is they just go around and scavenge for all free or any free radicals in the cell, and they do this by donating free electron to these free, donating their electron to the free radicals. Then you have the third line. In the third line, you have polymerases and all that, and also the fourth line. Then I want to look at the antioxidant. I want also look at the antioxidants in the pure itself. You have SOD. So much has been talked about it. It is SOD that can dismutate the superoxide anion, which is one of the most reactive free radicals in the body. So it will dismutate it to, and at the end of it, you have hydrogen peroxide, molecular oxygen. And then this SOD2 has been implicated in so many other diseases, as we have heard, and this deficiency has been linked to many pathologies. Then you have glutathione, which is referred to as master oxidant, is a second line defense antioxidant, but is very, very important. The most potent antioxidant is synthesized in the body and majorly in the liver. And you know the importance of the liver when it comes to drug metabolism. So it plays a very big role there in drug metabolism. It prevents and delay damages to important cellular components caused by ROS, such as peroxides and lipid peroxides. Glutathione is involved in the metabolism of xenobiotic compounds, like I've said earlier, in the liver after the first phase of metabolism, of oxidation, reduction, and all that. What glutathione will do, it will conjugate with that product, and at the end of it it will be able to be excreted through the urine, bile, and the feces And then it also take part in it's also important in the immune system of the body from the lymphocytes that I said earlier. And then it protects the body from heavy metals. In fact, glutathione we bind with methyl mercury to prevent mercury from binding to proteins, especially can cause can cause organ damage. So it prevents that by binding to it so that it does not bind to proteins. Then you have aloe-esmenin, and this is a polysaccharide extracted from aloe vera. It has immunosuppressant, antiviral, antineoplastic, so many properties about it. Then you have NAC, which is a precursor to glutathione in the body. It acts directly as a scavenger also. So apart from being a precursor to glutathione, it's also a free radical itself. And then you have alpha-lipoic acid, which also is a scavenger of free radicals, and it can also regenerate other antioxidants. In fact, most of the antioxidants in this group, they have a way of regenerating themselves. So I would say there is power in this bottle of Pure SL, in this product called Pure SL. With the tri-active technology, what you have is you have the SOD, which is the first line, which will take care of the superoxide anion which end product will be hydrogen peroxide. Then you have the glutathione peroxidase, which is a first line defense antioxidant also. It will not take care of the hydrogen peroxide to water and to give us water and molecular oxygen. And there is also bioavailable glutathione. For the first time, we have a product that is delivering glutathione directly to the cells. And then you have N-acetylcysteine, which is a precursor. So the cell is properly covered. You have the SOD, you have the glutathione peroxidase, the glutathione itself, and then the precursor. So this formulation ensures that the body has enough antioxidant to fight oxidative stress, which has been implicated in many disease conditions. It increases the availability of glutathione, the body matter oxidant, through the direct introduction of bioavailable glutathione to the cells. It also helps in the synthesis of glutathione. So in conclusion, I would say that Pure SL can be said to have the capacity to deliver antioxidants through direct and indirect means to the human cell to prevent or reduce oxidative stress. It therefore has the potential to offer great benefits in resolving diseases, especially chronic ones that are due to oxidative stress. Thank you.
Yeah, thank you so much, Ejiro. That was really powerful. Thank you for that perspective. We've heard it from the medical perspective, and now we're hearing it also from a pharmacist perspective. The pharmacological view of the product called Pure XL. And interestingly, Pharmacist Ejiro is a Nigerian. We're going to be hearing from a pharmacist all the way from Ghana. He's one of our is a pharmacist that has an MSc in drug technology, and he manages a chain of pharmacies in Ghana. So, ladies and gentlemen, let's make welcome pharmacist Samuel Okrah as he takes us on his own version of the pharmacological view of Pure XL. Mr. Samuel.
I see that he's there, but I think his microphone's having issues. He's not showing a microphone.
All right. Well, let's just move forward. When he comes, we'll queue him up again when he comes.
Let me step in and say something while we have just a moment. Just to make it clear the intent and how Pure brings the product to the market. We are not here to treat, cure, or mitigate in the disease realm. We leave that to the licensed professionals. The doctors, the pharmacists that deal with those things. You have the liberty with your patients to say whatever it is you feel compelled to say under your license. As a person who's the formulator and bringing this product forward, our goal was to support the doctor so that there's something there where you can use the supply and support for master antioxidants, which removes oxidative stress. That's a structure function claim we are able to make about those ingredients. And in so doing so, it allows the doctor to remove a lot of the noise and to be able to get right down to the root of the breakdown that's in the health issue so that you can treat the way you want to under your license. The other thing that we do is we support the patient or the individual in their body with the supply of these master antioxidant and the support ingredients. So our job is to supply, not treat, cure, or mitigate. Thank you.
Awesome, George. We have pharmacist Samuel with us. So Samuel, are you ready? Please go ahead.
Yes, I'm ready, Dr. Ben. Nice to meet you all once again. All right. Today I'll be very brief because much has been said already. But I'll be taking up with antioxidants and anti-inflammatory in viral disease management. We have been making a lot of positive noise about pure products, and I believe that viral disease management cannot do without pure products. I'll be taking an in-depth knowledge about inflammatory processes, and then also how pure products can help reduce the risk of these virus disease in ourselves. My outline will be looking at introduction, types of inflammation, chronic inflammation, acute inflammation, chronic inflammation and disease. Then what I am currently working on personally as an IBO, what are termed synergetic benefits of pure products. You shall also look at why we need to use patented glutathione as a means of complementing our treatment in our patients and even ourselves. Now, reactive oxygen and nitrogen metabolisms play a complex role in many diseases and in metabolic regulation because viruses replicate in living cells. And then what it means is that, and for all that you have heard in current issues about the viral disease around, these viruses replicate itself in the living cells. Now, low levels of reactive oxygen species play a role in mitogenic activation and the early phase of lytic and non-lytic virus infection. Indeed, resembles that of mitogenic cell activation. What are we talking about here? What we are saying is that these viruses are toxic and can be held responsible for numerous diseases that occur in the heart. During viruses could contribute to the systematic effects of virus growth. Oxidative stress, which is our main point of focus, has also been shown in human immunodeficiency virus, which is HIV infection in humans, and also activation of a lot of these diseases may activate replication, also to the loss for T cells. Now, antioxidants and viral treatments, such as agents, could not only alleviate disease symptoms, but also decrease the long-term effects of chronic oxidative stress, which have been linked to the development of viral disease and some viruses. The bioactive compounds found in foods and medicinal plants are attractive molecules for the development of new drugs with action against several diseases, such as those associated with inflammatory processes, which are commonly related to oxidative stress. Many of these compounds have an appreciable inhibitory effect on oxidative stress and inflammatory response, and may contribute in a preventive way to improve the quality of life through the use of diet rich in these compounds. And that is why we have info by providing these compounds that we take without worrying ourselves with food nutrients which are not found in our locality, which might contain these antioxidants. Now, what are the types of inflammation? I may not bore with the details as we are all have
Hey, pharmacist Samuel, are you there? I think you're having issues with your connection. Can you hear us?
I can see him, but I don't hear him.
Yeah, I can see him as well. Samuel, can you hear us? Can you check something with your connection? We can see your slide, but we can't hear you. We can see your slide, but just no audio. All right, so that's beautiful that we're just learning every day. Okay, I think he's going to reshare slides. So what we're going to do is we're going to move on. We're going to move on to the next item on the call. The next item we have on the call is going to be delivered by one of our top doctors, who is a surgeon from one of the best organizations in Nigeria. He's going to be talking about complementary therapy, Purxcel, the triactive technology. And this person is no other person than Dr. Ray. Dr. Ray is an orthopedic surgeon, and he works for the Federal Medical Center, Abuja. So, Dr. Ray, we're happy to have you on this call. So, Dr. Ray, if you're ready, please go ahead, Dr. Ray. Dr. Ray, please go ahead.
Thank you so much, Professor Ben. A pleasure to be in this forum and to speak on this particular topic. Greetings to the Nigerian Medical Association, the leadership of PURE, contemporaries in this particular meeting. I so much appreciate it. I'm going to be discussing on the complementary therapy with the use of our triactive technology. A lot has been said, and we've heard all. I'm just going to rest on the aforementioned the discussions. So we're not reinventing the wheel in what we're doing, or discussion about the use of antioxidants in this place. But what we're doing is not novel. Rather, we are really taking advantage of the new proprietary package that this company has to show us the benefit of this the benefit of using this complement what we are doing in our medical care. So I'm trying to share the screen. Okay, you'll help me to share the screen. All right. Okay, Mr. Charles, you share the screen from that end.
Yes, I'll share. Yeah, you can just go ahead.
I was having a little issue connecting, but I think I'm through now. Yeah. So maybe if you can just stop the sharing, let me connect from here so I can control it. So sorry about the little hitch. Now, once again, my name is Dr. Ray, as already been introduced, and I'm going to be discussing on the triactive technology as a complementary therapy. Like I said, it's actually a paradigm shift in the sense that this has been happening in other climes where the nutraceuticals have been employed in medical care to complement what they're doing, and a better significant outcome are achieved in the treatment of our patients. The role of Purxcel as the triactive technology to achieve this cannot be overemphasized. Like already shared, we see the prescriber digital in the prescriber digital reference, that's pdr.net. You can appreciate the fact that the information is fully there. Now let's look at some of the health conditions based on research that have been going on, based on what others have been doing, understanding the fact that it has been in the research over the decades about the use of the antioxidants to complement what we're doing in some of these health challenges we encounter in our management. Let's pick some of the main chronic conditions. For instance, hypertension. Robert Zuska made a research in June 2016 and they show that disturbances in glutathione metabolism might explain some age-related increases in blood pressure. So we already understood the negative balance in the reduced glutathione and how its depletion can be responsible for over 74 degenerative diseases. Now, this study has confirmed that and suggesting a possibility of complementing this, or at least supplementing it to be able to correct that. Now, let's also look at SOD, that's superoxide dismutase, in the management of hypertension, or complementing what we're doing in hypertension. Jian Park et al., in his study in published in American Journal of Hypertension, that was 2002, yes, but he was able to find out that the membrane permeable SOD mimetic is actually a model study that this attenuates the progression of blood pressure elevation in a model of severe hypertension. These effects were associated with reduced vascular hypertrophy, decreased degeneration of oxygen radical, and increased plasma antioxidant concentrations. Our findings suggested that oxidative stress plays an important role in the pathogenesis of hypertension in Sutherland's model, and that process may be due in part to reduced sensitive vascular remodeling. And that was then. Now, looking at diabetes mellitus also, and glutathione, Consuelo Borras et al. In 2018 did a study on glutathione metabolism in type 2 diabetes and its relationship with microvascular complication. This is a human study. It's actually a peer-reviewed case control study that was done in 2018. Reduced synthesis of glutathione contributed to deficiency in patients with type 2 diabetes, and it is more marked in those with diabetic complications. There may also be increased reversible utilization of glutathione by non-glycemic mechanisms. So either overutilization of the existing glutathione that endogenously synthesized, or there is a reduction in the production, overutilization or reduction in the production. The exact mechanism wasn't very clear, but suggested was on the possibility of supplementing this, that this might help to revert or enhance the care of these patients and the recovery. We also have glutathione in diabetes mellitus, and Kai et al. In his study discovered that glutathione deficiency in type 2 diabetes impairs cytokine responses and control of intracellular bacterial infection. That was a study that was published in 2012, Journal of Clinical Investigation. So the finding was that poor interleukin-12 production correlated with the deficiency in intracellular reduced glutathione concentration in diabetic patients. And the addition of glutathione as well as NAC to selectively restore interleukin-12 and interferon N-gamma production and improve bacterial killing. Further depletion of glutathione in the mice led to increased susceptibility to melioidosis. Melioidosis is one of the intracellular bacterial infections, and so that means that patients with diabetes can be exposed to more intracellular bacterial infections that are recalcitrant to treat because of low glutathione, and so supplementation becomes important. So this can complement the care of your diabetic patients. Now, that's about glutathione. SOD diabetic mellitus, Okoye et al. In a study in Nigeria, Rivers State, in 2016, discovered that type 2 diabetes is associated with decreased antioxidative status, as the level of oxidant enzymes, SOD, and glutathione peroxidase were significantly reduced in the diabetic patient. The increasing duration of the illness further depressed the antioxidative system. As the disease condition progress, antioxidative parameters are further depleted, showing an increase in oxidative stress. It is thus recommended, that was part of the study recommendation, that oxidative therapy be incorporated in the management and therapy of type 2 diabetic patients to supplement the endogenously synthesized antioxidants such as the glutathione, such as SOD. And so what we're talking about here is that in the triactive technology of Purxcel, where we have especially these two master antioxidants and all the complementary ingredients, can perform that particular function that these researchers were actually recommending for. And so we have a product that is a breakthrough that can help to achieve the diabetes with the use of aloe as Simanol. Samane et al. In April 2015, in his study that was published in PubMed, it's called the use of aloe vera extract in pre-diabetic patients could revert impaired blood glucose within 4 weeks. But after 8 weeks of the use of this, could actually alleviate their abnormal lipid profile. We know that many diabetic patients also have abnormal lipid profiles. So if you can maintain this for a short length of time, this study showed that aloe high molecular fraction, that is Asimanol, prepared by patented hyperdry system, exhibited a significant hypoglycemic effect. It can lower not only the glucose, but also the triglyceride levels, which are often in diabetic patients. So, and this study were carried out with no hepatonephrotoxicity detected in some researches. And so that is then triactive technology in fertility, and this glutathione and fertility, according to Iwuafor et al., another study that was carried out in Nigeria and published in PubMed, showed that glutathione is the body's major antioxidant, which helps in preserving all other antioxidants. It is a natural antioxidant present in both the male and female gametes, and its level vary widely. It has been confirmed that it plays an important role in maintaining the biological value of germ cells, and it has been implicated in the fertilization process and early embryo development. Another study now focusing on SOD and fertility, similarly, was carried by Surasendi et al. In 2017. That study showed that administration of SOD in the intrauterine insemination program provided higher pregnancy rates than placebo, even though the results were not so significant. Antioxidant administration also improved response of ovarian stimulation and significantly increased endometrial thickness, and then subsequently the pregnancy rate. The use of antioxidants, mainly SOD, seems beneficial in certain cases, including older women and cases of primary and recent infertility. Now, a broader research is needed, though, and conclusions not yet there, but all these factors are pointing out what Purxcel has come out to really help us in the medical field to assist our patients in different conditions we're managing. If you go in the lot of researches, many different diseases and many disease conditions, there are a lot of researches on that, but I'll just pick a few of them to showcase to us that this complementary therapy is actually needed now. Olufemi et al. In their study in May 2019, that was another Nigerian study published in the Pediatric Hematology Oncology, revealed that the findings in the study suggested that deficiency of some antioxidants, measuring them, including manganese, vitamins A, C, and E, SOD, and glutathione peroxide, is one of the non-genetic factors that are associated with vaso-occlusive crisis in children with sickle cell anemia. It is possible that those with more severe disease have an increased requirement as a result of oxidative stress, or they have higher losses of micronutrients, which may contribute to the disease severity. And so complementing the care of these patients with triactive technology might go a long way to help these patients. Now, Dosumi Ogumbi et al. Dosumi Ogumbi et al. is another Nigerian study published in PubMed in 2019, September, less than a year ago. The role of SOD in maintaining vascular homeostasis also contributed to the vital part it plays in modulating sickle cell disease pathology. So further exploration of events that led to SOD2 activity regulation of sickle cell will provide a clearer understanding of SOD role in the progression of sickle cell disease pathology and potentially produce improvement in clinical outcomes. In particular, importance of SOD in the vascular wall has not been thoroughly investigated. That is the affirmation. But we anticipate that SOD supplementation would confer protection to the endothelium during acute and chronic oxidative stress events, potentially reducing the incidence of pulmonary hypertension. That was your study. A lot of studies, we still need to, support all this, but it's getting clearer in the horizon as we see all these studies coming up. Now let's look at some of the neurodegenerative conditions like glaucoma. Ferreira et al., in his study in 2011, the relationship between oxidative stress and neurodegeneration is not completely clear. That's true, but mentioned that free radicals can act directly as neurotoxic or may also function as secondary messengers to spread the damage. Our results would suggest that further research regarding the use of antioxidants as an adjunct therapy in glaucoma may be indicated. Treatment interventions to reduce in vivo oxidative stress may be important in patients with this disease. And so, trying to emphasize that those studies still need to be carried out in as much as focusing on the multifactorial causes of glaucoma and treating increased intraocular pressures. We also have to look in the direction of complementing what we're doing using a triactive technology. Cataract has also some researches on that. According to Lin et al. In 2005, overexpression of SOD1 in whole lens prevents hydrogen peroxide-induced oxidative damage, that's cataract formation, to the lens and subsequently control of gap junctions by protein kinase C gamma. Now, that means SOD supplementation might help in the care or reduction in the incidence of cataracts in the prone patients. Mandel et al. Also did a research on cognitive improvement with glutathione supplementation in Alzheimer's disease. We know that Alzheimer's disease is one of those very difficult conditions to manage. But this research in 2019 to compare bioavailability, the effect of oxidative stress markers, and the safety of a new sublingual, they were assessing a new sublingual glutathione assessment. But in the end of their studies, they reached out that a nutraceutical formulation containing NAC, among other compounds like our Purxcel, has shown some pro-cognitive benefits in Alzheimer's disease and older adults. Though this result was confirmed to be better once we have that, especially in the oral formulation, than the injectable NAC. Now, in conclusion, lots of studies have incriminated oxidative stress in the etiopathogenesis of many disease conditions. This invariably connect antioxidants as role players. Studies have also confirmed some of these roles at individual levels, just as we just discussed, picking up the role of these different components of master antioxidants at different disease conditions. But the triactive technology suggests comprehensive employment of these master antioxidants as nutritional supplements to obviate the consequences of the exhaustion in certain high oxidative stress conditions. This even applies even in younger children. And so that's why we are trying to encourage the complementary role of Purxcel in our healthcare services. Thank you so much.
Wow, that is amazing, Dr. Ray. We are so blessed to have you, and just the exposition of your knowledge. That is really exciting. I mean, think about it. You heard from our pharmacist, Ejiro, and then you hear from Dr. Ray. What does that do to me as a listener? I mean, that makes me know that we are up to something really special with this product. So we're very grateful, Dr. Ray. Great job, factually based, very sound and scientific. Great studies that covers different parts of medicine and science. So we really appreciate that. So the next thing we want to do is we want to give experiential and testimonial opportunities about our products. You know, we have the best doctors on this call today. We have heard from the best doctors today. And what we want to do is to allow for people or doctors who have used this product in their practices to be able to speak about that. Remember, we have different products, but for today we are focused on just Purxcel. But what we want to do now is to introduce you guys to Dr. Alex. Dr. Alex is from Ghana, and Dr. Alex will be the first doctor to speak about his experience using our products. He's the medical director of Hope Christian Hospital in Ghana. He's a renowned doctor in Ghana. We're very blessed and fortunate to have him. So Dr. Alex, please go ahead. And then after Dr. Alex, we're going to have Dr. Philip Okonkwo. So Dr. Alex, please go ahead.
Thank you very much, Ben. And thank you very much, Dr. Ray, for doing a very wonderful job. And I believe that we are on our way to getting Purxcel and Pure products to as many people as may benefit.
Well, it seems like we're having a lot of issues for internet in Ghana. So, Dr. Alex, are you there? I mean, we love our brothers and sisters in Ghana, but it just seems like the internet in Ghana has refused to cooperate today. So, Dr. Alex, are you there? All right. While we wait for Dr. Alex, we're going to invite Dr. Phillips. Dr. Phillips is the doctor here in Nigeria. Dr. Phil, we're very excited to have you on the call as well. He's an oncologist out of Abuja. We're so excited and so glad to have you here. Dr. Phillips, please go ahead.
Good evening, everyone. Nice to be on this call. Distinguished colleagues, ladies and gentlemen, it is indeed an honor and a privilege to speak at this all-important symposium. My journey with Pure started at a time when I was coming out of a deep tragedy of losing my beloved sister and having gone through post-traumatic stress disorder, which, as we all know, presents in form of insomnia, flashbacks, nightmares, severe anxieties, and sometimes cognitive delays. However, I was privileged to get one of the first few bottles of the Purxcel that came into the country. And after taking it for 3 days, I discovered I slept better, woke up refreshed, and gradually the improvement was all round. This was one of the many experiences that prompted my in-depth research into the basic nutraceutical ingredients that are behind the triactive technology weakness in the formulation of the product with two master antioxidants in glutathione and superoxide dismutase, and the probiotic and active aloe acemannan, along with 15 other synergistic ingredients which can stand alone in their individual rights, coming together in the product Purxcel. I will not delve deeper into this, as my distinguished colleagues have thoroughly done justice to this already. Unfortunately, my revered colleague, Dr. Alex, was supposed to have presented clinical studies, clinical testimonies, while I do the other. Unfortunately, the network has not been too good. But let me carry out my own duties to present what the Purxcel represents to the public and what the people out there have to say. Permit me at this stage to share my screen as I read some of the testimonies.
So you just unshared your screen, so can you reshare it again? You were sharing it already, so just reshare it again, please.
I think you can continue. I'm actually
I have with the two key important testimonies before I play you a video. Because of time, I'm sure we'll not be able to go through all the other testimonies. The first one says, my testimony is an amazing result I got after I took Purxcel. I tested positive for the H. pylori last year, and I've taken so many drugs, including it and lots more. I started taking Purxcel last week, and after 3 days, I noticed I no longer have those ulcer crises, both at my abdomen and at my back. I continue the Purxcel daily. Yesterday being Saturday, I ran another test for the ulcer H. pylori, and it came out negative. Up till now, I'm still surprised. What an amazing product. Please, this product is really working. I'm a living testimony. Another testimony I want to share with us is one that goes thus. Good day, doctor. My name is Pastor Samson Aluko. I'm 53 years old and have been married for 24 years. I want to confirm that your Pure products work. I have amazing testimonies to confirm this. Like I mentioned earlier, my wife and I have been married for 24 years and yet to conceive when I was introduced to Pure products by Dr. Phil, specifically Cleanse, Purxcel, Daily Build, and Miller. We have done several tests which revealed that my wife had fibroid and I had low sperm count. The first remarkable thing that happened was that she was scheduled for surgery, but there was a strike action by doctors. So the surgery was postponed. Meanwhile, while waiting, Dr. Phil asked my wife and I to take Cleanse for 7 days. Thereafter, commenced the Purxcel continuously. To our amazement, the size of the fibroid started shrinking, and her PCV, which was about 22 before now, started going up until it got to about 32. Though she eventually went for surgery, but her womb was not taken out as originally planned, because according to the doctors, what they saw when they went in was different from what they had anticipated. We know this was the result of Purxcel. Also, in the last test I did, my sperm count had gone up to 35 million, which is a departure from what it was when it was last done. At that time, it was less than 12 million. Thirdly, we were told that the healing process would take about 3 months before we can hope to see any sign of menstruation, since she was already showing premenopausal symptoms. It was only a 50-50 chance. I'm happy to say here, she didn't only start menstruation, but 3 months into this, today, she has taken it, and we are praying for a safe delivery. As a man of God, I see the hand of God in Pure, because what we have spent many years and resources looking for solutions for, God has used Pure and other Pure products, Purxcel and other Pure products to solve. Thank you, Dr. Phil, for introducing this to us. My wife and I are deeply grateful. What can we say? Then Purxcel works. It is a miracle product. Pastor Sam Aluko. I will take this time to quickly play a video. Charles, if you can do that for me on your end, maybe just one of the 2 videos. The first one.
Charles, you got to put the speaker, the sound to come through the speaker. Remember that.
Hello, is it playing?
Just 1 second, please. Stop the share, Charles, and then select the speaker sound, and then share it again. Phil, I think the video is not going to play, so just move on to the next. Just wrap up, please, because we want to get Dr. Alex queued back up again.
Okay.
So just want to wrap up real quickly.
This testimony,
yeah, go ahead. We can hear you. Go ahead.
Having listened to these testimonies, one can only conclude that Purxcel is not just a triactive medical breakthrough technology, but it is one with a multi-dimensional, multi-faceted testimonials. Thank you very much.
Thank you so much, Dr. Okonkwo, Phillips Okonkwo. We really appreciate you sharing your personal experience. As a company, we care about you and your family, and it's always hard when we lose family members, but we care about you. We always appreciate it. So thank you so much for being very personal and sharing your personal experience and the experiences of some of your clients. Thank you very much. So what we want to do real quickly is we want to see if we can cue Dr. Phillips, Dr. Alex from Ghana. Dr. Alex, are you still there? We want to cue you for about 3 minutes. That way we give you the opportunity to talk about your presentation. So do we still have Dr. Alex from Ghana?
Also, Dr. Mac Moses is on, and he works.
We just got to move forward, George. We're not going to go back. We got more stuff to do. So, Dr. Alex from Ghana.
Okay, yeah. Let me share one testimony with everyone. I've been working with this man for quite a while now, about 8 years now, and she had a daughter who had happened to be having some kind of mental illness and has gone through several treatments over the years, and many medical seminars trying to discuss her case, diagnosis ranging from schizophrenia to bipolar disease to all the diseases that you can think of, and none of them was able to put a diagnosis to it. And this girl is not stable, cannot concentrate for a minute, has been talking to herself. So when I was introduced to Purxcel, I decided to recommend for them. And for a month after taking this product, he has seen wonderful and amazing improvement. This girl can now read, can now assist the mom to do household chores, and it is amazing. Just recently, he called me that I should not allow the Purxcel to get finished. Their stock also goes down. And so this means that the Purxcel is working. Then a senior colleague who had a botched spinal surgery and has been groaning in pain both day and night was introduced to this Purxcel. And now he's able to sleep well at night. The pain is reduced. The frequency has reduced remarkably. And we are hoping that after taking for about 2-3 months, he will be very good on the Purxcel. So these are a few, for the sake of time, I will want to share with everybody that we should not limit ourselves. We should be open-minded and just hold on to Purxcel and give it to our clients, for it is our ethically, mandated right or responsibility to let them know about the options that there are and what Purxcel too can offer. Thank you very much.
Awesome. Thank you very much. I just want to remind everybody about 2 things. Number one, we have many other products as a company in Nigeria, and Ghana, and South Africa, and any other markets we're going to be opening. But for today, we're focused on just the Purxcel. And I also want to remind everybody about what George Renniger said. George Renniger has really covered the history and the formulation of this product. It took a lot of time and energy and effort to make this thing done. But at the same time, we are not a drug. We are not a pharmaceutical, right? We're just a supplement that works at the cellular level. And when your cells are fully functional, we believe you will see some of these results that you have heard about today. So I just want to make sure that you guys understand that we're not a drug, we're not a pharmaceutical product. We do not cure, we do not mitigate, we do not heal, but we have seen a lot of successful results because of the cellular activity and action of this product. So what we want to do next is introduce you guys to the 4th paper for today. And the 4th paper for today is the application of antioxidants and anti-inflammatory in the management of viral diseases. And to do that, we're going to introduce you guys to a very, very important personality who is a strategic partner with us through the ICON project with the Nigeria Medical Association. So it's my pleasure to introduce you guys to Dr. Tonnie Okoye.
Good evening, everybody. My name is Dr. Tonnie, and I'm here to talk on the applications, the role of antioxidants and anti-inflammatory agents in the management of viral infections. Introduction to the pathogenesis of viral infection. Pathogenesis is the process by which an infection leads to a disease. Viruses are small particles of genetic material, be them DNA or RNA, that are surrounded by a protein coat. Some viruses also have a fatty envelope, like the SARS-CoV-2 that causes COVID. Viruses are incapable of reproducing on their own. They depend on the organisms, on their hosts, to be able to survive. Some viruses perform other good functions. Viral infections. What is a viral infection? A viral infection is a proliferation of harmful viruses inside the host, as they cannot reproduce without the assistance of a host. They display tissue specificity, or what we call tissue tropism. Viruses infect a host by introducing their genetic material into the cells and hijacking the cell's internal machinery to make more virus particles. This is one of the ways that virus, the process of direct injury to cells, this is one of the mechanisms. Symptoms of the viral illness occur as a result of cell damage, tissue destruction, and the associated immune response. Associated immune response, highlighted in red, is one of the ways that viruses do a lot of damages, like the COVID-19, SARS-CoV-2 virus. Their parasitic replication robs the host cell of energy and macromolecular components severely impairing the host's ability to function and often resulting in cell death and disease. Next slide. Pathogenic mechanisms of viral disease include implantation of virus at the portal of entry. That's one of the ways it causes disease. It can also cause disease, local replication within the cell. When it invades a cell, when it gains entrance into a cell, it can cause disease within that cell, and that's the local replication, which will lead to the bursting and death of that cell. Spread to target organs, like I mentioned earlier, tropism. A lot of viruses have tropism that have cell or tissue specificity. They attack specific cells. That's why, for instance, COVID-19 has a lot of predilection for the lungs, for the cells of the lungs, the alveoli. Spread to sites of shedding of virus in the environment. Then the factors that affect the pathogenic mechanism include key three factors that affect the pathogenic mechanism: the capacity of a virus to cause disease, accessibility of virus to tissue. For instance, a lot of the products, they have the antioxidants on the skin. For instance, SOD. There's a lot of SOD on our skin that helps to create the first mechanical barrier, against the entrance of virus into the tissue. So, but when the virus has access to any tissue, the chances to cause disease within that tissue greatly increases. Cell susceptibility to virus multiplication. Some cells, if they are susceptible, that means they allow the virus to multiply within them, and that means that the virus has gained command of the machinery of the cell. It will be able to command the machinery of the cell to produce its own particles and deprive the cell of continuing to produce its own type. Then the third factor that can affect pathogenic mechanism by any virus is virus susceptibility to host defense. And this is where our products come in. Because if the host defense is so potent, so effective, the virus may not be able to do great damage. And that's why we are here today. The next slide. Direct cell damage and death from viral infection may result from when the virus finally gets into the cell. How can it kill the cell? How can it cause disease? Diversion of the cell's energy. We know is given for, basically, when any cell is deprived of energy, ATP, like I think Ejiro mentioned. Once the ATP system is hijacked, the cell can no more find energy. Starvation naturally will kill that cell. So that cell will die. Shut off of cell macromolecular synthesis. That's another way that it shuts down the cell and kills it. When a viral infection gets into any cell. Condition of viral mRNA for cellular ribosomes. Next one. Indirect cell damage can result from attack of the viral genome. Then the cell-mediated immunity. Here we're talking about the last part of introduction to pathogenesis of viral infection. Viral infection stimulates or triggers of cell-mediated immunity, and by this we mean the recognition and killing of virus and virus-infected cells by leukocytes. Once viral infection gets into a cell, there are specific cells that will be mobilized to attack that virus, that will recognize that virus as an invader and begin to attack it. The production of different soluble factors like cytokines by these cells, when stimulated, once a viral infection has happened within a tissue, within a cell, two things happen. The virus-infected cell will begin to release certain cytokines like interleukin alpha, while the immune cells within that host will begin to release interleukin gamma. And these are cytokines that are necessary to deal with that virus, to neutralize the effects of that virus. This is part of the inflammatory response in viral infection as it happens in COVID-19. Because I'm going to use COVID-19 as an example of a viral infection. And I'm going to use glutathione and SOD as examples of anti-inflammatory and antioxidant agents. Cytotoxic T cells, natural killer cells, and antiviral macrophages can recognize and kill virus-infected cells. Helper T cells can recognize virus-infected cells and help to produce a number of important cytokines. But these cytokines the production of these cytokines must be modulated in order to avoid cytokine storm. The next slide. Oxidative stress, the role of oxidative stress in viral infections. Oxidative stress is implicated as a pathogenic factor in a number of viral infections as it alters immune functions. You can see the reference there. Some researchers have shown that nutritionally induced oxidative stress exacerbates the pathogenesis of certain viral infections, like the Coxsackie virus. The change in virulence was found to be due to changes in the viral genome. Virus-induced activation of phagocytes is associated with oxidative stress, not only because reactive oxygen species are released, but also because activated phagocytes release pro-oxidant cytokines. That means when a virus infects a cell, when there is a viral infection, part of the cascade that will be triggered off will be the release of reactive oxygen species by the cell and pro-oxidant cytokines. And it usually comes in a wave-like form. That's what we call a cascade. It occurs when redox homeostasis, what is oxidative stress? It occurs when redox homeostasis within the cell is altered due either to an overproduction of the reactive oxygen species or to deficiency of the counteracting antioxidant system. That means there is a disequilibrium, that is redox homeostasis is lost when you have either increase in production of reactive oxygen species, that's oxidative stress, or you have a deficiency in the counteracting antioxidant system, like depleted glutathione or depleted SOD. Once you have that happening, then the system has lost the redox equilibrium, and you'll be moving towards a state of oxidative stress, and it's commonly induced by viral infections. If not strictly controlled, oxidative stress can be responsible for the induction of several diseases, both chronic and degenerative, as my colleagues have said, as well as speeding up body aging process and cause acute pathologies. It is a consensus among many researchers that oxidative DNA damage is one of those stimuli responsible for cancer development. Reactive oxygen species production basically relies on enzymatic and non-enzymatic reactions. And that's why we are so wonderful to be blessed with a product that has both the enzymatic and non-enzymatic antioxidants. Enzymatic reactions able to generate reactive oxygen species are those involved in respiratory chain, prostaglandin synthesis, phagocytosis, and cytokine P450 system. These ones are able to generate reactive oxygen species. The critical organs like kidneys, liver, heart, lungs are negatively affected, like it's been demonstrated by my colleagues, by oxidative stress, mainly because of the fact that reactive oxygen species production induces the recruitment of inflammatory cells. Once reactive oxygen species are produced, the next trigger, the cascade, will lead to the recruitment of inflammatory cells and pro-inflammatory cytokine production, leading to an inflammatory, to initial inflammatory stage. When viral particles gain command of the cellular mechanism and production of more progenies, that's more virions, more viral particles, the inflammatory response gets exacerbated into an overdrive, or what we now popularly call cytokine storm in the COVID-19 era. And of course, cytokine storm has its sequel that we shall see. So the roles of antioxidants and anti-inflammatory agents in managing viral infection. Like I said, I will restrict my talk to just two antioxidants and anti-inflammatory compounds, the glutathione and SOD. Glutathione is a tripeptide consisting of cysteine, glycine, and glutamine, and one of the most abundant antioxidant preventing oxidative damage of cells from reactive oxygen species. Maintenance of highest concentrations of reduced glutathione in most cell types highlights its vital and multifunctional roles in the control of various biological processes, such as detoxification of foreign and indigenous compounds, and so on. Oxidative stress, another very important thing that glutathione does is that it regenerates vitamin C and E. I emphasize this here because a lot of people will say, once I have vitamin C, I think I have no more need of antioxidants. It's not true. Vitamin C, when it has donated its molecule, cannot regenerate itself. It needs glutathione to regenerate, to reduce it, and not allow it to become toxic, produce its toxic metabolites. So even if you use vitamin C as an antioxidant, you need glutathione to be able to regenerate vitamin C and E. Oxidative stress induced once the balance of generation and neutralization of reactive oxygen species is broken in the cell, and viral infections are notorious for causing this. It plays critical roles in a variety of natural and disease process. Another powerful endogenous antioxidant relevant to our discussion today is the SOD, the superoxide dismutase, which constitutes a very important antioxidant frontline defense against oxidative stress, which is reactive oxygen species mediated injury in the body. When we say oxidative stress, in simple terms, it means reactive oxygen species induced or mediated injury in the body. The enzyme, including its mimetic analogs, act as a good therapeutic agent against reactive oxygen species, that is the SOD. There are a group of metalloenzymes that are found in all kingdoms of life and catalyze the dismutation of superoxide anion free radical into molecular oxygen and hydrogen peroxide, and decreases the oxygen ROS concentration, which will damage the cells if left at excessive level. Whenever reactive oxygen species is left at excessive level in any cell in any tissue in the body, it will lead to damage of the whole cells. They serve as anti-inflammatory agents and can also prevent precancerous cell changes, that is the SOD. Natural SOD levels in the body drop as the body ages. Hence, one becomes more prone to oxidative stress-related diseases with age necessitating supplementation. SOD is used in cosmetics and personal care products as an anti-aging ingredient and antioxidant. As an antioxidant due to its ability to reduce free radical damage to the skin, therefore preventing wrinkles, fine lines, and age spots. And it also helps with wound healing, softens scar tissue, protects against UV rays, and reduces other signs of aging. I took time to list this here because this is the value we get in a molecule, in a capsule of Purxcel, because of the potency of the SOD inside a capsule of Purxcel. It has been reported that SOD has an important link in several human health problems, including RBC-related disorders and so much. Furthermore, a strong association between the activity of SOD and Alzheimer's disease has been suggested by some researchers. And from the testimonies we had today, I think the one from Alex from Ghana, I think a man had a neurodegenerative disease, and when placed on Purxcel, the person began to regain the neural functions back. This is an evidence. Thank you. Neutrophils play a central role and essential role in the pathogenesis of inflammation. SOD serves as an inhibitory agent of neutrophil-mediated inflammation and may stand as a novel therapeutic approach for the ROS-dependent tissue damage induced by neutrophils through several mechanisms. The pathophysiology of SARS-CoV-2, like I said, I've talked generally about viruses, but I want to narrow down to SARS-CoV-2. SARS-CoV-2 is the virus that causes coronavirus disease 19, COVID-19. Patients with COVID-19 show clinical manifestations including fever, loss of smell and taste, non-productive cough, dyspnea, myalgia, fatigue, normal or decreased leukocyte count, hypoxemia and radiographic features suggestive of disseminated intravascular coagulation and pneumonia. These symptoms are similar to those of SARS-CoV and MERS-CoV, the Middle East Respiratory Syndrome coronavirus infections. Coronavirus spike protein, H protein, has been reported as a significant determinant of virus entry into the cells. The enveloped spike glycoprotein binds to its cellular receptor, and the cellular receptor on the cell that has attraction for SARS-CoV-2 is angiotensin converting enzyme 2. This angiotensin converting enzyme 2 protects the lungs, but it loses that ability when down-regulated by SARS-CoV-2. When the virus enters the cells, its antigen will be presented to the antigen-presenting cells, which is a central part of the body's antiviral immunity.
Dr. Tonnie, if you don't mind just wrapping up, we really appreciate that.
Once somebody gets infected with SARS-CoV-2, which causes COVID-19, there's activation of the inflammatory response. But the inflammatory response gets to exaggerated level. It gets to exaggerated stage, which is what is commonly called the cytokine storm, because of the potency of the organism. And then that will lead to so many other events leading to acute respiratory distress syndrome. And when that happens, the cytokine storm, when it is uncontrolled, because it's an uncontrolled systemic inflammatory response resulting from the release of large amounts of pro-inflammatory cytokines and chemokines by immune effector cells. There is a growing consensus from early researchers on SARS-CoV-2 responsible for COVID-19 about some major ways of the pathogenesis, and these include direct cell injury. SARS-CoV-2 causes direct cell injury. There's pulmonary edema arising from the increased pulmonary vascular permeability. In response to the pulmonary edema, which is inflammation in the lungs are tends to fight back, thereby releasing its soldier of cytokines, gathered by the chemokines in massive manner, characterized as a storm. The pulmonary edema further obliterates the blood oxygen in the lung, the blood oxygen exchange in the lungs, and precipitates hypoxemia, which is a cascade leading to more hypoxemia. Okay, in conclusion, so the current understanding of the pathophysiology of COVID-19 as an example of viral disease, we can glean the peculiar place for both antioxidants and anti-inflammatory agents. It is also more beneficial to conclude that early or routine supplementation of antioxidants and anti-inflammatory agents in both healthy cohorts and those with age-related depletion or such as due to pre-existing comorbidities will be one of the options in the fight against COVID. The use of bioavailable glutathione and its precursor NAC or an SOD fortified with alloesmenin in a very potent fixed-dose combination such as Purxcel is strongly advocated. Natural SOD levels in the body will decrease as we age, necessitating supplementation. Can we have the next slide? Yes. An extensive literature analysis of the works of many scientists across the globe and their case series studied by the team led by Alexei Polonikov concluded as follows: that glutathione deficiency is exactly the most plausible explanation for serious manifestation and death in COVID-19 infected patients. The major risk factor established for severe COVID-19 infection and related glutathione deficiency found in COVID-19 infected patients with moderate to severe illness have further reinforced the conclusions that oxidative stress contributes to hyperinflammation of the lung, leading to adverse disease outcomes such as acute respiratory distress syndrome, disseminated intravascular coagulopathy, and multi-organ failure and death.
Oh, Dr. Tonnie, thank you so much. That's a great presentation. We do really appreciate the amazing job you just done. I cannot express how thankful we are for such amazing doctors as yourself, Dr. Ray, Dr. Alex, Pharmacist Ejiro, Dr. Phillips, and every other person who has spoken today. One of the things we keep talking about today are the two ingredients of Purxcel. We've talked a lot about the SOD and the glutathione. What is funny is that when we were making that product, we spent a lot of time on those two products, but we also remembered the power of aloe vera because of the areas of cellular information and communication. So I want to introduce back George Renniger. I just want George Renniger to speak real quickly about the active aloe, the acemenin. George, just take about a minute and just speak about that aspect of cellular communication and that the acemenin brings to the product. So George Renniger, go ahead, please. George Renniger, please go ahead.
Okay, you see that on the screen? Okay.
Yes, go ahead.
Okay. So it's a triactive technology, and as you've heard about today, we've talked a lot about the glutathione, whether it's bioavailable or intracellular, what can happen. You've heard about the SOD. Like Benjamin has said, the aloe-acemenin ingredient, the reason I know so much about that is because I am friends with those that held the patent for kind of the discovery, the isolation, and the ability to stabilize that active ingredient. And so as we look into what is that aloe-acemannan, it's the active ingredient that is in the gel. It's a mannose molecule. It's actually a biological sugar molecule that actually is not just on the surface that it's active, but inside the cell, it actually is what enables the cell to express on the surface what's going on inside. And this is a science that, if you want to write this down, it's called glycobiology. And it is a up and coming emerging science as well. And we'll show a little bit of that toward the end of what I'm saying. But, you know, Harvard has a whole glycobiology department. And it is this code of sugars that enable the cells to communicate on the surface what's going on inside the cell. Just like a doctor, if you can have the patient describe their symptoms correctly, you know what to do. The immune system is the same way. How many of you know that almost all disease is either an overactive immune system or an underactive immune system? And so this molecule operates for cellular communication. And so these are just a couple of other PubMed studies that were motivational for us when we were putting this product together. But acemannan has various medicinal properties like osteogenic, anti-inflammatory, antibacterial, with the accelerate healing of lesions. Aloe-acemannan is known to have antiviral, anti-tumor activities in vivo through the activation of immune responses. Now notice that's antibacterial and antiviral in that same molecule. It was concluded that aloe vera has immense potential as a therapeutic agent. Aloe vera, the second study here, aloe-acemannan, considered one of the main bioactive polysaccharides of aloe vera, possesses immunoregulation. Now that's the function of what happens when cellular communication is correct. The body knows to dial it down or to turn it up. Anti-cancer, antioxidation, here's your oxidation again, wound healing and bone proliferation promotion, neuroprotection, intestinal health promotion activities, among others. There's over 44,000 studies on PubMed regarding this. And I put this together. I just want you to take a look at that. That's Harvard in the upper left-hand corner. That's Canada running their own symposium. That's a global symposium in Vienna, Austria this year. That little picture you see in the middle there, that is the acemannan with sugars hanging off of it, enabling the cells to communicate. And it is a powerful biology. So to wrap up the entire part of it, this is the kind of the closing cell slide regarding Purxcel, kind of a summary of what we show on our normal slides. And it is from that great product that we reveal an incredible business opportunity. And Benjamin, George, I'm prepared to do that when you'd like me to do that. So
absolutely, George. Thank you so much for just re-emphasizing the point of fact that, the active aloe in our product actually by itself could account for a lot of benefits for users. So thank you very much. Before we come back to this presentation that George would do, remember, guys, if you have a good product, you do have a good opportunity to be impactful in business and in your community. But before we come to that, I want to introduce you guys to one of our leaders from here in the United States. This person is going to be doing a summary. This person is going to be doing a summary of the presentation from a holistic point of view, from a natural point of view. And to do this, I want to introduce you guys to Dr. Phillips. Dr. Phillips, we are so glad to have you on this call. So I'm going to hand it over to you, and we are looking forward to hearing from you. So Dr. Phillips, just take about 2 minutes and just do a summary of everything we've heard, and then put a natural spin to it. Thank you very much.
Absolutely. Thank you so much for inviting me on. There's nothing at all that I can add to the beautiful presentation that you put forth today. I will share just a couple brief slides. I'm a relative newcomer to the PURE company. Prior to seeing PURE, my goal was to return people to the garden. What I mean by that is that so oftentimes we get disconnected from the earth, from each other, from the sun, from electrons in the ocean. We get disconnected. So part of what I always teach my clients, and again, I'm a PhD, I'm not a medical doctor, I'm a PhD of holistic natural health and nutrition. But what I was always trying to do is return them to the garden. What I've found is that Pure products, and specifically this Purxcel product, actually saves me a lot of time as a practitioner. There's two reasons. One is because of the synergies that the product selection, the formulation has offered to my clients. The way the product works together saves me a lot of time, not only in terms of them getting the products into themselves, but I think more importantly, in terms of compliance. We've talked for a long time here about how things happen on a reductionist level, but my goal is how do I get people to adhere to the protocols? How do I get them to comply? Because if they're not compliant, then none of this is going to work anyway. So we talk about synergies, we talk about balancing things, and we talk about natural compounds. Prior to Pure, I was actually giving people doses of turmeric. We noticed that when we did give them turmeric, the bioavailability was enhanced in the presence of black pepper extract. So when I looked at the label of Purxcel and I saw that they had turmeric and they had the black pepper extract, and these are secondary and third, these are not the primary ingredients. These are the synergistic ingredients. These are the extra ingredients. I thought to myself, somebody really knows what they're doing here. There's also ALA. So when we introduce a fatty acid, we have an even more beneficial bioactive synergy. You know, we can talk about glutathione all day, but glutathione cannot carry its load all by itself. So to have a hydrophilic antioxidant like vitamin C as an added ingredient, and then have a lipophilic antioxidant like vitamin E, as well as ALA, somebody really knew what they were talking about when they introduced these products and put these in the formulation. So my hat's off to you. I'm a brand new person to this product. I'm still learning it, but this is a really great job you've done here. I also am very impressed that you've added selenium and also NAC. These are building blocks for glutathione. I personally was supplementing with cruciferous vegetables, which are very high in sulforaphane. People can't produce glutathione if they're deficient in sulfur. So once again, Pure, you've done a great job coming to the table with sulfur as a building block. So you've done a great job here. As you look through the list of all the other ingredients, I grow my own moringa. I grow my own broccoli. You are doing a great job. For those people who cannot grow their own ingredients and can't get these, this is one-stop shopping. I have my own blueberries. But listen, milk thistle, when you look at these ingredients, pomegranates, you've done a wonderful job. I think that we're just on the tip of the iceberg in terms of bringing wonderful things to the world. And we're excited because just this week, we were able to get these products, this particular product, Purxcel, here in the United States. I kept it really brief. I wish I could go into more, but I'm really grateful to you, Dr. Ben, for your leadership. Charles, awesome job there. I give it back to you. Thank you.
Awesome. Thank you so much. I mean, we do appreciate you. We're very glad to have you as an addition to our company and to the great thing we're doing all across the world. It's kind of funny. We almost locked ourselves in a hotel, myself and George, to to get to the end of this wonderful product that you all see. But it's been a good journey. So thank you very much. But I just want to remind everybody about two things. Number one, we are still not a drug. We're an amazing product. We're not a drug. We do not heal. We do not cure, right? But we're an amazing product that works at a cellular level that allows a lot of great things to happen, because we all believe that when the cells are functioning properly, your body begins to express itself the way it's supposed to. So we're posting a link to a survey at the bottom or in the groups, in the chat groups and all that. Please endeavor to complete that survey, because when you complete that survey, you have the opportunity to provide your email so we can share these slides. I mean, is that an amazing slide from Dr. Phillips? Dr. Phillips, your slide is really good. So we're going to have those slides available to share. So everybody who's presented today would appreciate getting your slides back. That way we can create some marketing materials around it and some stuff to give to our people. Because everybody's like, I want the slide. I need the slide. I need the slide. So we're going to have the slides available. George Renniger, we want your slide as well. So don't keep it away from us. But guys, you've heard how amazing these products are, how amazing Pure as a company, how amazing the formulators of this company. You even heard from George Renniger. So what I want to do is give you guys that are on the call the opportunity to ask questions. If you have a question, please go in the chat group and type it up, and we'll be able to answer them. We got great doctors, Dr. Ray, Dr. Phillips, Dr. Alex, Dr. Mick Moses, everybody. We just want you to type it up. We're not going to be able to take voice questions. We want to take written out questions, and we'll be able to answer them. So George Renniger is going to be helping me with this session, whereby he's going to go in the group, and if he sees any question that we can answer, we're going to answer. And we're going to take about 5 minutes to do this, 5 to 10 minutes to do this. And once we're done with that, we're going to talk about the other component of our business, of our company, of our product, which is the business angle of our product. So please go ahead and ask your questions in the chat group, and I can assure you that we're going to answer them. So thank you very much. So George, do you have a first question, George?
Do I have a question?
I do have a first question from the chat group. Do you have a question we want to respond to?
Well, there are things like how the Ghanaians get the CME. You know, there's a post that's been in the chat a few times now, and maybe Charles, you can post it again. It gives people the electronic document for them to fill out so that they can get a CME credit. In Ghana, I'm not sure if we finalized that. That's something we'll connect with Fred on, but we've had a relationship with the GMA as well, so we'll have to see about the approval of that.
So what we could do about that, George, is it's just like a university transcript. You can take the details of the training and take it to your organization and present it to the organization, and they'll be able to give you an equivalent amount of credits for this training. So we'll give you the details of the presentation, the speakers, the topics, and then you can move forward with that. So what are other questions in the group? Somebody had asked about the dose of the product. This product is so good and so powerful that you just need to take one tablet, one capsule a day. So that's the dosage. And then George, for the age requirement, what's the age requirement for this?
Well, you know, this product's manufactured in the United States, and we declare that it's not for children or pregnant lactating women. There's certain studies that have to be done if you're going to market your product to that age group or somebody in that category. So we market it as an adult-only product. That said, you know, every individual can manage their household as they like. My children take the product. But it's not marketed that way from the company. So these are functional ingredients that every human that's alive, even animals, have need for some of these ingredients in their body. So, you know, it is marketed, though, specifically towards adults.
So what George is saying, in other words, is that we're approved by NAFDAC and FDA, and every other country we're going to be going to, FDA Ghana, by that I mean. We're approved for just people that are for adults, and we're not approved for pregnant, nursing, or children. So that is what we've been approved for, and that's what we market. If you decide to go in another direction, that's not from us. How many in the bottle? Dr. Duprez, you've asked that question a number of times. How many in the bottle? We sell the product as a 1 month supply, and as a 1 month supply, that is the cheapest number one, this is the only bioavailable glutathione in the market in Africa. This is the only one. And despite the fact that it's the only one, we sell a month's supply cheaper than any other competitor or any other similar, not even similar by definition, but any other glutathione products in the market. We are the only bioavailable product in the market, and we're cheaper. We give you a better bang for your dollar than any other products in the market. I hope that answers your question.
And the answer also is that a bottle has 15 capsules, but we make 2 bottles as the month supply. And the reason we did that is because when you're moving into financially fragile markets, you need to micro sell. Somebody can take this product and over a 2-week period have a very, positive result, and therefore know that they want to spend and buy the next bottle for the following, 15 days is actually, so what's in there for at a 1 capsule a day supply. But the bottle does say 1 or 2 capsules a day. You know, I take more than one a day, but that's because I'm so toxic, right? You know.
Awesome, George. George, you just answered the next question I was going to bring. So thank you very much. So the next question, actually, we're going to have George answer it because we believe that if you have a good product, you have a good business. Because somebody has asked, how can I get involved in the marketing and distribution of Purxcel? So with that being said, I want to introduce you guys again to George. He's already on the camera, so I'm not really doing an introduction. So George, can you speak to us about the business aspect of this? Can you just take about 7 minutes, George? I know you planned 15 minutes, but I just want you to do in 7 minutes.
Okay.
All right. Thank you, George.
Well, I am going to bring up the PowerPoint real quick, and I will zip through it is in 7 minutes. So you start the clock, Benjamin, and I'm going to walk through this pretty quick. But we have something called the Pure Prosperity Plan. We want product in, toxins out. We want prosperity in, poverty out. And so we're building a $1 billion brand here, and there's compensation for each and every one of you because of our powerful products. So we have 10 ways that you can make money. You can see from retail bonuses, pack bonuses, sponsor bonuses, team bonuses. We're going to jump right into them because these upfront monies is where you see that retail profit and preferred customers. Mid-level money is through the sponsor bonus, pack bonus, and rank bonuses until you move into those bigger residual monies that come from strong team bonuses, lifestyle leadership bonuses, generational bonuses, leadership shares, things that you're seeing on the screen. I mean, people understand retail. Buy at wholesale, sell at a retail price. Depending on which pack you buy, you get a little bit better price on certain of the products. And we have some sweet spots as well that we've designed for Africa. So 50 all the way up to a 500 PV pack that you can buy actually will make you commission active for a specific number of weeks, anywhere from 4 to 16 weeks, and those packs pay a bonus. So if Benjamin was an IBO and he was sponsoring me as an IBO and I bought that 100 PV pack, he would get a $30 pack bonus. And I want to note this. This is something other American companies have never seen done. Regardless of whether you are active, you will still be paid that pack bonus. That means somebody who has absolutely no money at all can register with Pure and begin to do invitations and presentations or bring people to things like this and start making money immediately until they can order their own products and start to earn the rest of the bonus. That was a special dispensation. We also do not flush points. As you accumulate points and you grow in this business, we don't flush points. They do drop out automatically, but you can call the company when you reactivate. They bring all your points back. Powerful thing that Benjamin and Chairman Jung were able to do for us. Number 2, there's also something called a sponsor bonus. Beyond the pack itself, the pack has a PV associated with it. There is a 10% of the PV that is paid out for the first 90 days. So when somebody buys that 100 PV pack, not only would there be a $30 pack bonus, but a $10 sponsor bonus. And that's what this slide is showing you, the total amount of money you can earn if you're active, because the sponsor bonus is only paid to those that are active. The pack bonus is paid to everyone. There's a team bonus. Team bonus is built around this binary hybrid compensation for those that understand compensation. For those that don't, it's very simple. You have a group on your left and a group on your right. It doesn't matter whether they're on their first level or the 100th level. The total left is added up. The total right is added up. Whatever is that lesser team volume, you receive 10% of the PV in a check. And so in Ghana, we use 5 as our converter. So for every US dollar is worth 5 Ghanaian CD. In Nigeria, we're using 370 as a converter. In South Africa, we're using 17 as a converter. And so here's an example, 3,300 PV on your left, because every product you purchase has a PV associated with it. So everything in the tree, everybody that's ordered, that all gets totaled. And in this model, you would receive 3,000 PVs, the low side. You'd receive a $300 US check, which would be converted to your own currency. How do you grow in rank in our business? It is really based around 3 primary things. This isn't a training today, so I won't get into it too much. But basically, as you grow, your left and your right teams, as I showed you, but also the people that directly come into your business through your own activity. It's like we have families. We have uncles and aunties that all have children, and they're part of our family, but they're not part of our family, right? This bonus operates the same way. We look at your lesser team volume, and all your uncles can all, aunties can all, be counted there. But this compensation also measures how many people did you personally bring to the business, and how many did they bring to the business as we look at your genealogy in the business. And so this is all built around volume. As you move through the ranks from bronze, silver, gold, platinum, sapphire, you can see we have a number of ranks. And as you go through the ranks, if you look at the far right column, you can see that there's maximum amounts of money that can be earned. And so as we move up in rank, you can actually earn more money from the business. Next slide. There's also something called a generational matching bonus. As the people that are part of your genealogy earn checks, you have the ability to get a matching check on everything they earn. And like Benjamin said, this isn't a training, and I have like a few minutes, so I'm going to move through the big highlights. The other bonus that we have is a rank bonus. As you achieve rank, there are one-time bonuses that are paid on top of everything else the company pays on a regular basis. Somebody once called this free money, and it is. It's a rank bonus, free gift money from the company for hitting new ranks. It's from $1,000 when you hit the platinum level all the way up to being able to earn $250,000 US at the crown diamond level. So significant amounts of money. Lifestyle bonuses, when you hit one of these ranks at least twice in a calendar month, you receive additional compensation. The other, once you moved out of that level of compensation, you notice this is bronze to emerald. When you're in the diamond all the way at the crown diamond, there is a pool of money, 3% of the total company sales, that is shared among the people that are at these ranks, and it is a significant amount of money. We run incentive trips on a regular basis. Right now, we're still running a Canada trip that's going to wrap up soon, isn't it? And you can achieve that. We have a car program that we've added in Africa where once you've hit diamond, the company will partner with you to get a car that you'd like. And that is kind of the wrap-up of the comp plan without it being a training. But to give you an idea, there's a lot of money to be made here.
Awesome, George. George, you did such an awesome job. George, do you know anybody from your experience in the market that has made a significant amount of money? We've heard about Moses. Do you want to speak about Moses? Because I have somebody that's going to be hopping on this call as well that's going to give their personal testimonial. That's Dr. Scott Thomas. But just tell us about your experience of people really benefiting and making a lot of income from this business, George.
Yeah, no, it's a wonderful company, and the compensation plan, especially as it runs in Africa, is fast, aggressive. It's for the poor to be able to get out of their poverty, and it's for anybody that's making really good money to even make better money. We had people like Moses who came in, and honestly, he was hoping to make a couple of $100 US equivalent a month. You know, he's doing thousands of dollars, tens of thousands of dollars a month now, and it's blown his mind. We also have people that, it's simple moms and people that just want to be able to get their products for free or want a little extra money for school fees and so forth. So this plan is scalable. You can achieve what your vision is here with Pure. And it all comes down to registration is your first step. So if you're listening to us today, the first step is to get back with the person who invited you and do a registration with Pure. Pick that pack. I recommend the 100 PV pack or a stockist kit. But then from there, your invitations of people, you don't have to be an expert. Just get them to come out to these presentations that we're doing virtually and let us do the hard work lifting for you. And once those presentations are done, ask them to do a registration. Registration, invitation, presentation is the cycle.
Awesome, George. So is the registration free, or what does it cost to register, George? Do you know about that?
Yeah, it's absolutely free to register. If you're a person who's broke and has nothing, you can register. And you can actually begin to recruit and make money. But there is far more money if you buy a product pack. And so that product pack, we have a 50 PV pack and I'm not going to give all the different currencies on it, but basically my recommendation to everybody hearing my voice is we designed, with special permission from Benjamin and all the way up to Chairman Jong, the 100 PV pack in Africa was designed around the 1,500 PV pack in the United States. And it gives a bargain like you cannot find. But you know what? Sometimes you got to give those that are in financially fragile positions the opportunity to get the benefit of buying bulk volume. And we are the fastest growing market in Pure right now because of that 100 PV pack. Benjamin, what's the statistic? What's the average? How many percentage buy the 100 PV pack?
About 80%.
About 80%. And it's because the value is there. 7 bottles of Purxcel for 60,000 naira in Nigeria off the top of my head. 3,300 rand in
Awesome, George. Awesome. Hey, George, you know what is really cool? As you speak, our leaders that are on this call are taking that responsibility to go in the chat groups to answer some of the questions. So if you're a leader at Pure and questions are popping up in the chat group, please do what Darlene is doing. Please do what every other leader is doing. Just go in the chat group and try to respond to some of these questions. But remember, number one, we are not a drug. We do not cure, we do not heal, we do not mitigate. I've said this over and over, and George has said this. We believe in cellular health, and we believe after you achieve cellular health, you're going to see a lot of results and benefits in your personal body and in your personal life. So we do not cure, we do not heal. We're not a drug. We're not a pharmaceutical company. We are a wellness company. And this is the official talking points and position of the company. We do not cure. Somebody just asked again, how is it effective against stroke? Once again, we are not a drug. We're not a pharmaceutical. We are not indicated for any of that. We are a wellness company. We provide wellness products that work at the cellular level. We believe if you're healthy at the cellular level, you're going to see health all across your body.
If somebody wants to dial in about a specific disease, you know what we have at Pure that other companies just don't? We have doctors. You can go see a doctor that's aware of this technology, and they can talk disease level with you. Awesome. But that's between you and them as a patient to a doctor relationship. It's not anything that we market on at all. We support the nutrients that your body needs. We are a supplement company, but the science is amazing. See your doctor if you want those specific answers, or go do some homework yourself and check in with your doctor is what we recommend.
Awesome, George. Awesome. Thank you very much. And don't forget, guys, try to complete the survey that you're being sent, because we're going to be able to send you the slides. We're going to be able to add you in the WhatsApp group. And please do not forget, go back to the person that invited you to this meeting. And if you came through Facebook or any of that, just complete the survey if you came through our social media, and then let us know how you got to this call. So I want to invite the final speaker to this event. This person is a good friend of ours. He's a leader in the company. He has been very, very interested in helping us work and build in Africa. And we want to give him the opportunity to just speak about his personal experience with the company, speak about his personal experience with what he's seen his team do in Africa. And we are very excited to introduce you guys to Dr. Scott Thomas. Dr. Scott Thomas is a top leader in our company, and we're very happy to have him on this call. So, Dr. Thomas, please go ahead.
Hey, Ben, thank you so much. And, usually they say the best to last, but in this case, we have had the best over and over and over, the very best minds, the best doctors, the best healthcare providers, and the best formulator. And so I'm so grateful to sort of back up and just say thank you. And let me just say, I've been a pastor for 35 years. My PhD is in New Testament and Greek, and an emphasis on ancient economics. And so I'm very privileged to have been to Africa on many, many occasions. We have many friends there. And here's what's exciting. And so I want to just, number one, confirm that the business side, the money is real. The money is big. The money is available to you. And the second thing I want to confirm is that you can do this. I was a pastor, then I got into the corporate world, and I was working a 90-hour-a-week job. And I saw this business, And we jumped in, and very rapidly, in fact, in 3 weeks, we made $22,000. In 90 days, we locked in a 6-figure income and are continuing to lock that in even now. And so I want to say, number one, it's real. Number two, you can do it no matter what your schedule is, because it's about leveraging your time. It's about you sharing with a few who share with a few, and then the efforts of many, many people doing small amounts, and it's huge. And here's the third and the final thing. Timing is everything. Timing is everything with your patients. Time is everything with your friends and family, and timing is everything in this business. I actually saw this business 4 years earlier, and I passed up on it, which turned out to be the biggest mistake I ever made. I circled back around looking for peace, looking for financial security, looking for a passive residual income, and the man shared with me, I said, if I would have jumped in 4 years earlier, where would I be? And he said to me, there were 400 people put in above you, which could have been put in below you. So I said, what does that equal financially? And he said, it's $2.5 million. And I choked back tears. I told my wife, get us enrolled. And she enrolled us. And I said, you get us enrolled while he tells me how to jumpstart this thing. And so I'll just conclude by saying the money is real. You can do this because it's about leveraging friends and leveraging the time. That's the key. And then thirdly, do it today. Do it today. Do not hesitate one more moment. So, Ben, thank you for the time, and what an incredible day. And I'm so privileged to be last. I love it.
Awesome, Scott. Dr.
Scott.
Thomas, thank you so much. We do really appreciate you. And, man, I cannot tell you how much I've learned just listening to these doctors. I come from the business and from the pharmaceutical angle of this whole medical spectrum, but just listening to the doctors is just an amazing thing today. So thanks everybody that has contributed. I want to say special thanks all of our doctors, to George Renniger, Darlene McGregor, and everybody that has been on this call. You guys have been so amazing. We have been so blessed just to have you guys on this call. As a company, we appreciate everybody. We respect and value every one of you that's on this call. And I want to also extend a special thanks to our founder, Mr. Jung, and my president, Bobby Love, and all of our leaders here in the U.S. and all across the world. Remember, we're expanding all across Africa. And remember, if you're a doctor, like Scott said, timing is important. All of your colleagues are going to be using these products. You heard it today, and I would advise you to be the one to take it to your colleagues. Do not wait for them to bring it to you, because you have the opportunity to hear it today. Do not wait for Scott when you're $2 million behind and you try to jump up George, right? So what I want to do, I want to invite to the call our African director, Mr. Mike Mocha, to just kind of close on this. But before he does, I want to say we valued all of the time and attention that you've given to us. Remember, it's very important that you complete that survey. It is very important that you complete that survey. And after this call, what we're going to do is we're going to leave this open so chats can be going on. People can be asking questions. And for those of our leaders that are available, please try to respond to this. But very critical from a corporate perspective, we're not a drug. We're not a pharmaceutical product. We do not cure. We do not heal. We do not mitigate. We do not do anything. We have zero medical indications. What we do is that we cleanse, we balance, and we build your body. And we believe when we do that, we see a lot of results. So at this point in time, what I want to do is I want to invite to the stage our African director, who has been working really hard to make sure that all of these benefits that you see all across Africa is available to all of you that are here today. So please join me and welcome Mr. Mike Mocha.
Wow. What an interesting time. I'm so excited. Thank you. On behalf of PURE, I appreciate and thank all participants on this program, particularly our guest speakers from the US and our medical doctors that are giving justice to all the topics this night, and our medical practitioners in audience, and everyone who has sacrificed time to participate on this program to the very end. I want to believe that we have gained a lot from the information and knowledge imparted on us tonight. We look forward to a more beneficial relationship going forward. Thank you very much, and we appreciate it.
Awesome. Awesome, Mike. Thank you very much. Guys, I see a lot of people posting their emails and phone numbers in the chat group. When this stops, we lose all that data. Please, there's a form. Charles, can you post that form in the link now, in the chat link? There's a form we're sending out now. Please click on that form. If you keep posting your phone numbers and your emails in the chat group, you are not going to get the slides and you're not going to get added in the WhatsApp groups. Please click on the form. You have the opportunity to put your information and we get back to you. It is very important. Somebody just posted their phone numbers again. We are not going to be able to send anything to you. But please, this is going to be on. The form is going to be there. The chat forum is going to be open. George Renniger, go ahead, please.
Oh, I'm just filling out the form myself right now while I'm talking to you. So, no, I just need to get that form filled out. But now's the time to take action. Thanks so much for being here today. You know, it doesn't work if you don't eat it. You know, at the end of the day, all of this science today, nobody needed to know it. All you need to know is open your mouth, swallow it. It works. So let's go out and put the product out there and let it do the work for us.
Be the one to take it to your colleagues. Do not wait for them to bring it to you because you have the opportunity to hear it today. Do not wait for Scott when you're $2 million behind and you try to jump up George, right? Remember, it's very important that you complete that survey. It is very important that you complete that survey. And after this call, what we're going to do is we're going to leave this open so chats can be going on. People can be asking questions. And for those of our leaders that are available, please try to respond to this. But very critical from a corporate perspective, we're not a drug. We're not a pharmaceutical product. We do not cure. We do not heal. We do not mitigate. We do not do anything. We have zero medical indications. What we do is that we cleanse, we balance, and we build your body. And we believe when we do that, we see a lot of results. Make sure you go back to the person who invited you to this event. You have to do that. And then once you do that, the person will be able to tell you exactly what you need to do. And then Benjamin said, this is not a drug. This is not a pharmaceutical. And we do not cure. We do not heal. What we do is we help to cleanse your body from a cellular level. We balance and we build it. So do not forget that. It is very important. Very, very important. And George, what did George say?
Yeah, you just got to, open your mouth and swallow. It works, So.
All right, awesome. All right, so Charles, music, and then we're going to go up and just answer the questions in the chat group. So thank you very much, Charles. You did an amazing job. We appreciate you and all of the staff.
Yeah, Charles.
Elizabeth, Mike.
Dr. Ray, awesome,
Greg,
man.
Dr. Ray, everybody. Great job, great job. All right, Charles, music. Let's go in the chat groups and try to answer some of these questions. So we're going to meet you all in the chat groups. All right, thank you very much.